Ardhito, we are live in Facebook.
Great. Thank you, Pak.
Okay.
Thank you, Pak Yam.
Yeah, thanks.
Dear Shamila, you will be able to stay for the whole meeting?
Yes, I will stay until 10:25. I have a meeting at 10:30.
Okay, so
in fact, I will. It's a brief meeting, and I will come back and join you.
Wonderful. That's great. Okay, Pardito, you can make a start anytime, just to make sure that colleagues who are joining on the live Facebook, they don't think like there is any delay. So over to you. We can't hear you. You need to unmute yourself.
Yes, good afternoon, everybody, and special good afternoon for our ADG of Natural Science, Madam Shamila, Professor Shahbaz from Unesco Office Jakarta, and Pradip Khatiwada from the Inspire Alliance. And also, thank you very much for all the presenters that has been confirming participating in this webinar. Also special welcomes for all the attendees and all the participants either through this Zoom webinar as well as through the Facebook Live. We have quite a heavy agenda that we would like to try to cover within this 2 or 2.5 hours, sharing about the Asia Pacific youth and young professional engagements in COVID-19. So not to, as we have quite a long agenda, I would like just to start this activity or through inviting our chair of the You Inspire Alliance, Mr. Pradip Khatiwada, to give a kind of a welcoming remark or opening remarks. So I invite Pradip for this session.
Thank you, Aditya sir. Namaste, good afternoon, everyone. It is my pleasure to welcome you to the webinar on youth and young professionals in Asia and the Pacific engagement to COVID-19 on behalf of You Inspire Alliance. We are grateful to Unesco Jakarta Office, Regional Science Bureau for Asia and Pacific for their tremendous support for this joint collaboration of this webinar. I would like to thank Madam Shamila Nair, Professor Shahbaz Khan, Ardhito Korajit, and entire team at Unesco Jakarta office for their guidance and for this collaborative opportunity. I believe this webinar is just a beginning and we have a long way ahead. Amidst the pandemic outbreak of COVID-19, people around the world are being widely affected. The increasing number of COVID-infected cases has not only created a state of emergency, but also has waxed extreme level of fear, desperation, and hopelessness among the people. Well, is it just the hopelessness? I think COVID-19 has given also an opportunity to generate a lot of energy that is harnessed constructively, can be a great source of innovation. We'll be hearing some of the great stories and innovations today. COVID-19 has unlocked innovation from the grocery or the food delivery app. There is a WhatsApp chat box that notifies customers when to shop. And there is also a initiative called I Will Travel Again to support travel companies through a gift cards. There is this initiative led by a student group called Vital Marks, smart respiratory marks that monitor vital signs. There are initiatives like low-cost ventilators, PPE, face masks, face shields. These are some of the examples of the initiative led by young people around the globe. In this period of pandemic, I have been leading a technical team based in Nepal together with a research-based partner in India to co-design a COVID monitor platform. The platform has been a common tool for many countries in Asia Pacific region. The COVID taught us a mechanism to deal with a common problem with a multidisciplinary aspect to promote South-South cooperation. I believe there are wonderful innovations led by various groups that needs to be documented, communicated, and collaborated for dealing with future crises. The UNDP 2016 estimates Asia Pacific home to 1.7 billion young people under the age of 25. Many countries in the region are experiencing a youth bulge, more than 20% people in the age of 15 to 24 age group. However, a large young population in the region are out of quality education, and especially girls and women are still following traditional pattern of study and are underrepresented in science, technology, and engineering. It is well proven that in any nature of crisis, young people are in the forefront to respond and to find out innovative ways to deal with it. We're happy that UNESCO has recognized this potential of youth and young professionals and has been supporting for the Alliance activities from its inception. We look forward to work together with UNESCO in collaborative, immediate, medium, and long-term action plan in near future. I would like to remember Professor Rajiv Shah for always being a motivation and encouragement for You Inspire Alliance and its activities. Similarly to Dr. Animesh Kumar from UNDRR for promoting role of youth and young professionals in various capacities. A huge shout out to Sufyan, Rahma, Kharul, Ifta, Ghani, Sachi, Ibam, Yama, Fazar, Maria, Ilan, and Sadia for your tireless work on the preparation of this webinar. I sincerely hope you will all enjoy and participate fully for the entire session. Thank you all for your participation.
Thank you very much, Pradip, for this enlightening remarks. We appreciate and we look forward to hear from the other youth on the activities. Next, I would like to invite Professor Shahbaz as the Director and Representative of UNESCO Regional Science Bureau for Asia Pacific, UNESCO Office Jakarta, to give the remarks. Pak Shahbaz, the floor is yours.
Thank you very much, Pa Ardito, and with very excellent start from Pradip, who is now at the moment in Nepal, and colleagues who have joined throughout the Asia Pacific region. We are so delighted to have our ADG, Madam Shamila, who is a scientist herself and is a big promoter of science with young people, and there has been a similar effort in Africa she has led. And I'm also very happy to report today that we have 376 registered colleagues from 46 countries, including from Africa, from 16 African nations, as well as from Europe and from US. So it's truly a global forum of the young people. And I welcome all of you. You are our hope for the present and for the future. And UNESCO Science, Natural Sciences, especially with our colleagues from headquarters. Anna is also with us from the executive office. We are there to work with you very, very closely. And as has been mentioned before, Professor Rajiv Shah is also with us from KO University. He's a great colleague, and also Animesh from UNDRR and Chunli Han from China, the Disaster Center. So dear colleagues, today we are working on some very important areas for COVID from the science, engineering, technology, and innovation. And you represent many of those disciplines. There has been an excellent response to this survey. I'm very pleased to see many of the colleagues are directly working on the COVID, and we will hear those stories from them as they are going to explain to us what their work is. Today we have 11 networks under the You Inspire, which was started by Jakarta office. Within a very short period of time, it has become a tremendous alliance from 2019. And COVID, as the WHO has put it recently, you must be following the news, that it's not just going to go away. We have to become smarter. We have to continue to work on these science-based solutions, science-based evidence. We have to work together to uplift our hopes. Very importantly, to link with our communities and societies where we are working, and also with the national disaster management authorities. And we will hear that many of you are already working with them. And then how do we bring the culture of innovation where we can find solutions together? Solutions have to be found from the vaccines, the medicines, the innovations in ventilators, which many colleagues are doing, but all the way to how do we represent the lessons which we have learned together. And in that regard, UNESCO Office Jakarta is already working on documentation of some of the lessons learned from the patients who have recovered, the hope stories, and also very importantly, how do we link with communities. Also at this time, we have to be very careful also to understand there are other disasters which can happen at the same time. So in that regard, we have Indian Ocean Tsunami Information Center hosted by Jakarta office, which is actually two of the very important pillars of UNESCO science sector, which our ADG is the leader, Shamila, and IOC. So IOC and Natural Science are working together. This center is hosted by the Indonesian government, and we have come up with first ever guidelines for how do we cope with the situation of tsunami. Today we have Draza Shah from Islamabad office. We are working with the National Disaster Management Authority there as well. And we are looking into how do we come up with guidelines for managing disasters such as floods. So this is just to give you a bit of flavor of what the work is being done. And also very importantly, gender is a key dimension of our work with the youth. You would be pleased to know today that in terms of the people who have registered, there are 162 female colleagues and 214 male colleagues. Majority of the colleagues in our database who have registered are in the age group of 20 to 29. Very, very important age group. But we have as young as less than 19 and as old as more than 60-year-old colleagues who have joined us as well. So majority youth and young professionals, but guided by some very, very good colleagues as well. So I want to express my gratitude to all of you from UNESCO Office Jakarta, led by our team with Ardito, Gani, Sachi, Yama, and many others who are contributing and working with you in each one of the networks from You Inspire. Let's continue to work hard. And I'm really looking forward to this joint statement in which we will have actions clearly defined, which we work together with our headquarters. And youth is a very important part of all the strategies of UNESCO. And we work on large projects together to help transform this difficult situation into more manageable situations in the countries where we live, and we promote South-South cooperation. And also I would invite you on the 19th of this month, where we are going to bring our key donors, Government of Japan and Government of Malaysia, for scoping science-based actions as a follow-up to the ministerial conference, which was organized by our dear ADG Science. And that should also have a very important component of what we come up today and the statement which came out on open science from Islamabad. So thank you very much. Let's listen to those key presentations and presentation from our ADG, and let's work together to make this a useful opportunity for all of us to come up with actions which can make Asia Pacific region a safe region, working together, finding solutions, and serving the communities where we are, and connect with each other no matter when there are difficult times. This e-connectivity can continue to promote natural sciences in the best possible way for disaster risk reduction. Thank you.
Thank you very much, Professor Shahbaz, for the remarks on opening. And I would like to now invite our Assistant Director General of Natural Science of UNESCO, Madam Shamila Nair-Bedouelle, to give the key remarks related to the topic that we are discussing today, which is youth and young professional engagement in COVID-19. I would like to invite Madam Shamila. The time is yours.
Thank you. Thank you very much, Adito, and good afternoon, good morning to all of you. Firstly, allow me to congratulate you, our Jakarta office, and the team in Jakarta who have supported this event, an important event under the leadership of Professor Shahbaz Khan. I would also like to thank the colleagues in Paris who have also contributed to this event. Thank you, Adito, and all the colleagues there. But I want to sincerely thank the UN Inspire. I believe that without the UN Inspire Alliance, we would not be able to host such a webinar with such a wide representation across the world. So this is the first time that UNESCO is hosting such a meeting with UN Inspire, who has brought on the young people from across the world and across the regions. So my congratulations to you and thank you very much. I greatly appreciate this initiative. And the Asia Pacific Youth Forum has really stood out with young professionals in raising the voice of youth, the role of youth, not just in this pandemic, but also in addressing disasters, disaster risk reduction, mitigation, and contributing to policies across the world, be it protecting our Mother Earth, or be it biodiversity protection, and even raising awareness of the COVID. Today, the COVID has increased the local, regional, national, and international appreciation of the importance of disaster risk reduction, awareness, and preparedness. Welcome to the home, to your home, UNESCO. UNESCO's strength builds upon its mandates with all of its stakeholders, and you, the youth, are crucial not only to the mandate of UNESCO, bring the education, the science, the culture, and the communication to all peoples of the world, but you also hold the key to promote the transmission of our core values and our shared values so that we can ensure, while humans are completely dependent on biodiversity and Mother Earth, we ensure that there is an ethical consideration in our interactions with Mother Earth. I would like to really take this opportunity to encourage all of you that this crisis is an opportunity to reflect, to share experience on the harmonious interactions between humans, biodiversity, humans and the Earth and the planet, and learn how to reconnect with nature and biodiversity everywhere in the world. The world is facing the spread of this pandemic, globally affecting people. The Asia Pacific region has been particularly affected, and I will not go into all the numbers because these are varying on a daily basis. But one of the ways that we are called upon to stop the spread of the pandemic is the simple gesture of washing hands with soap and water. However, how many people across the world and in your region have access to safe water? And this is where the biggest challenge lies. That is why, together with one of the UNESCO Equatorial Guinea awardees of a Life Science Prize in February this year, we have launched what is called the Solar Water Disinfection Program. The solar water disinfection technology, which was established by an Irish scientist, enables countries, people, communities across the world to have this low-cost, affordable technology in order to disinfect water that can be used for washing hands and for cooking. So we would like to launch with you this safe water and sanitation disinfection measure that can be used by our rural communities during this pandemic. The SODIS technology will be launched, I hope, with you throughout the world and to all the youth organizations please do help us and support us in ensuring that every individual across the world will have access to water to enable them to wash their hands and contain the COVID. Different countries in the Asia Pacific are implementing different types of measures to control and contain the spread of this pandemic. We are looking here at different countries' measures, but we see that science, technology, and innovation is at the core of containing this pandemic, and you play a key role in contributing to those science, technology, and innovation measures. And I would like to congratulate every one of the individuals, all of you, and all those who are at the front line, who are fighting and enabling us to contain the pandemic, not only in your region, but across the world. It might be too early to talk about the lessons learned for future action, but we do need to reflect on measuring the scales and how we could be better prepared using science, technology, and innovation for better data collection, data gathering, information sharing. How can we be better prepared for the post-pandemic, but also to enable communities across the world to address the many global challenges? How can we identify risks, develop risk scenarios, and make plans and implement them to cope against these risks that may be more in the future? The Sendai Framework for Disaster Risk Reduction includes also biological hazards and risks, and the approach, therefore, to this pandemic would be very similar to other hazards, such as earthquakes, tsunamis, as Professor Shahbaz has indicated, the floods, the landslides, and other hazards. So we, as UNESCO, are organizing a number of different webinars across the world to be able to cope with the pandemic and sharing good practices from many different angles, be it the natural sciences, the social sciences, environmental sciences. And this is very important to share this knowledge across the world and to develop common strategies and solutions. UNESCO hosted a virtual ministerial meeting and dialogue on a very particular theme, which is called International Scientific Collaboration and Open Science for COVID. During this COVID, we have seen a unique collaboration and solidarity amongst scientists from across the world, beyond borders and beyond patents, sharing epidemiology, contain the pandemic and protect their nations. This is why UNESCO is promoting the concepts of open science, and the governing body of UNESCO, the 193 member states, in November 2019, mandated UNESCO to develop a recommendation of open science. And we have seen during this COVID crisis the true spirit of open science, sharing of scientific and technological data. The ministerial dialogue that was organized by UNESCO on the 30th of March for ministers from across the world and over 120 countries came up with a number of different ideas and thoughts for future collaboration, for networking, and sharing scientific data and information. You and Inspire, you are crucial to this dialogue. And I therefore call upon all of you to kindly be part of this movement of promoting science for development, because we do need science. We need more science. We need better science, but we need your engagement to ensure that no one is left behind. The mobilization of the researchers, scientists, and innovators will allow this free access to scientific innovation to reduce the knowledge gap between those who have it and those who do not have it. Science has really raised our standards of living, but how can we ensure here, home of UNESCO, home to the people of the world, that UNESCO can continue to promote the international solidarity through international access to the scientific developments needed today to raise our standards of living. On April 15, UNESCO also joined hands with the Africa Youth Advisory Board. This Africa Youth Advisory Board is also an important advisory board on disaster risk reduction. And I'm delighted to see that they are also joined with you in this You Inspire Alliance, because we believe that the future lies in this discussion and dialogue with the youth. The aim to raise awareness on the fragility of the planet, living in harmony with nature, and promoting a coalition between humans and nature, raising the social awareness and knowledge of the value of biodiversity and ecosystem services to avoid the tipping points and to avoid disasters across the world. We also need societal raising awareness on water safety and water security, biodiversity preservation, and livelihoods, as we have seen during this pandemic. I would also like to say that I am delighted to see that the role of youth and young professionals in the Asia-Pacific region across the world is so united today in especially assisting the world to provide solutions. We live more and more in an interconnected world, and the interdependencies are global. We need to support one another, but we need you to help us to design and co-design and co-create a future which is based on our common shared values. But we can also only do this with our youth, for the youth. After all, as we are going to celebrate 1 week from today, on the 22nd of March, we will celebrate the International Day for Biodiversity. And the theme is, our solutions are in nature. But our solutions also depend upon the intergenerational equity. And that starts with you, with our youth, to build this coalition for nature, values and respect for nature. And therefore, I look forward to working with all of you through UNESCO's networks of scientific collaboration, through UNESCO's networks such as you, to be able to raise the bar so that we are able to protect Mother Earth, not just for you, but for your future generations to come. So thank you once again. My sincere congratulations to all of us. Let us learn from the lessons of the Asia-Pacific countries, of the African countries, of the countries in Latin America and in Europe. Let us learn how to collaborate. Let us facilitate the capacity building. Let us share knowledge. You can. Yes, you can. Bring us all together under one common shared value, which is living in harmony with each other, living in harmony with nature, and ensuring that our biodiversity is preserved, conserved, restored, and our value for the living is transmitted. Let us reorganize our relationship with nature, disasters, or that when these come, our communities have the preparedness measures. So once again, my congratulations to all of you. Thank you, Professor Shahbaz. Thank you, Adito. Congratulations to all the youth alliances across the world. We are here. UNESCO is home. Let us work together. Thank you very much.
Thank you very much, ADG, for a wonderful opening remarks and keynote address. We are inspired. Thank you.
Thank you very much, Shamila, for the enlightening and motivating and inspiring message that you are conveying to all of us. I think we all take notes of the importance of the messages that you have just conveyed. Now let's proceed to the next agenda. And on this stage, I would like to invite all the attendees and participants. If you have questions, you can use the question and answers menu on the bottom of the Zoom webinar screen. You can post your questions and we will do our best to provide answers to any of the questions and comments. Now I would like to invite, as has been mentioned several times, that there are two youth platforms that has been quite active in this COVID-19, which is the You Inspires in Asia Pacific, as well as the Asia Youth Advisory Board in the African continent. And I would like to invite these two to share with us what I would like from the You Inspire Alliance.
Thank you, Pak Ardhito. I hope you can all see my screen. And my name is Rahma Hanifah from Indonesia, and I'm currently appointed as General Secretary of You Inspire Alliance. So I would like to thank you again to UNESCO for this very nice opportunity for collaborating with You Inspire Alliance. So I will introduce what is You Inspire Alliance. It is an alliance of youth and young professionals platform in science, engineering, technology, and innovation, SETI, to accelerate the implementation of disaster risk reduction and climate change in line with Sustainable Development Goals and the Sendai framework to support the DRR policy and action at local, national, and international level. Our vision is a strong coordination and collaboration for empowering youth and young professionals in science, engineering, technology, and innovation in disaster risk reduction at the global level. So if we do this alone, it's more difficult. But if we do this together, we are stronger. And that's the idea of You Inspire. It brings voice of youth and young professionals in SETI for DRR, creating and endorsing space for youth and young professionals to empower their role in SETI for DRR, bridging the valley of death, leveraging disaster data literacy and development of open innovation and creative problem solving, and science policy interface with youth and young professionals as the medium. This nice illustration is made by UNESCO Office Jakarta as our work together on developing the toolkit on youth and young professionals in SETI for DRR. So You Inspire started back in 2018, and in May, this 2 years ago exactly, the name of You Inspire come out firstly from Indonesia. We held our first regional workshop with UNESCO Regional Science Bureau of Asia Pacific, UNDRR, IADR, and Indonesia Science Institute of Science, or LIPI, and several prominent universities on the youth and young professionals in SETI for DRR. So during this moment, we launched our first regional chapter from Indonesia, soon followed by Pakistan and other countries in Asia. Then we had our first chance on a nice stage of You Inspire in the global platform for disaster risk reduction in Geneva, where we meet more youth from several countries. And then more You Inspire country is born in other countries such as Malaysia, Philippines, etc. And then we had, we gather all in Jakarta office, UNESCO Jakarta office on September 2019 with 8 chapters, and we declared the Jakarta Declaration on the formation of You Inspire Alliance, followed by the second regional workshop in Chengdu, IDMR Sichuan University, and after that, another 4 You Inspire chapter was born. So in total, we have currently 12 national chapter. So geographically, this is our engagement in the global level, how the enabling mobilizing youth can also make more dialogue and also make more collaboration, make more connection. And we are also given space to contribute in the global documents such as Word into Action by UNDRR and the report of the science technology report by Abstract UNDRR, and recently on the principle to address water-related DRR under COVID-19 pandemic by HELP. And this is the 12th chapter that we have now. Indonesia, Malaysia, Philippines, Thailand, Japan, Huaxia, China, Nepal, Central Asia, Afghanistan, Pakistan, India, and Maldives. And through this You Inspire Alliance, we can connect more youth in DRR. We have a global recognition. We could address transboundary problems together, catalyst in providing fuels and engine to You Inspire's chapter, and ensuring the strong collaboration between each national chapter or other youth and young professionals DRR platform that already exists. And of course, we really encourage all of you that is youth and young professionals attending this webinar to engage with Inspire chapters, here is providing the website and also the emails of each Inspire chapter. And we, during the last 1.5 year regional workshop, we understand on the roadmap from the Science Technology Roadmap, Global Science Technology Roadmap, and also the Young Scientists UNMBCY Roadmap. And we try to make in line the roadmap for youth and young professionals in science technology for SFDRR. And we come up with 5 main objectives. This is still open for discussion, of course. The first one is connecting youth and young professionals, encourage participation of youth and young professionals in science technology for DRR, and develop partnership between related organization, agencies in Asia and in global level, promoting dialogue, capacity building and networking, science communication, low cost and emerging technologies, socio-entrepreneurship, DRR-related public health and medical emergencies, and so on. The 4th is promoting access to DRR information, data, and technology. The 5th one is monitoring and evaluation, including collecting information on youth and young professional engagement in DRR and to the science technology report. And this is the structure of Inspire Alliance. It consists of advisory board. Currently, we have UNESCO Asia Pacific Regional Bureau Office and UPAIR. And also we have the assembly, consists of 1 representative from each Inspire chapters, chaired by Pradip Khatiwada from Nepal that gave remarks earlier. And we have co-chairs based on the region. In the East and Southeast Asia, we have Sufyan as our moderator today, and we have from the North and Central Asia and South Asia is Sam that will also present after this. And we have the secretariat consists of 5 main working groups: transboundary issue of DRR, socio-entrepreneurship, science communication and evidence-based DRR, knowledge management and communication. And we have task team for different issues. For example, now we have task team on COVID and on webinar. So this is the introduction of Inspire Alliance, and this material is available in this link of bit.ly. And if you want to know more, you can please access our website or social media. And as our ADG said, we hope that we can co-create, co-design something together from the youth, by the youth, and to the youth. Thank you very much, and I hope you enjoyed this this webinar.
Thank you very much, Dr. Rahma, for the presentations and the introductions of Inspire. As Dr. Rahma mentions, hopefully these presentations will also inspire others to join the Inspire either through the national chapters as well as through the Alliance. Again, just to remind that if you have questions, please use the questions and answer box that is available in the bottom part of your Zoom. Now, I would like, as also has been mentioned by our ADG, that on 15th of April, there is the African Youth Advisory Board on Disaster Risk Reduction webinar, which was held, and they have also provided a lot of good insight and input, and would like to hear from our colleague, Mr. Alberto Pancioli from Africa, to share the insight of the IAP UNESCO webinar on youth engagement on COVID for the Africa we want. Alberto, the time is yours.
Hello, good morning, everyone. Well, good morning from South Africa. I know it's later in the afternoon for many of the colleagues here. Thank you very much for inviting the African Youth Advisory Board for Disaster Risk Reduction to participate in this great webinar, and we look forward to future collaboration as we go forward together. So just a brief introduction to us. Well, actually, so my presentation is looking at the insights from the African Youth Advisory Board for Disaster Risk Reduction and UNESCO webinar on youth engagement on COVID-19 in the African continent. Sorry, there we go. So just a brief description of who we are. Our group is established by the African Union as a part of the key provisions and the Program of Action, or POA, of the Sendai Framework in Africa. Our platform is to promote a collective and meaningful youth engagement and involvement in disaster risk reduction in Africa and across the globe. We were established approximately this time a year ago in May 2019, and unlike you Inspire, we're quite small. We're only 14 members, as in 14 individuals across the 5 African regional spheres. Our mission is very much based off the priority focus areas of the Sendai framework to promote research and knowledge generation, youth inclusion and risk governance, youth empowerment and capacity building, and community engagement and outreach across the continent. Just trying to go to the next slide. There we go. So the webinar took place on the 15th of April, 2020, with over 100 participants joining us in the webinar, most of which coming from, most of which were young Africans, but we had multiple attendees from across the globe, from the Asian region, from Latin America, etc. And we had representatives from multiple organizations such as UNESCO, Inspire. We had representatives from the UNDRR Regional Office of Africa, Mr. Julius Kabubi, speak to us, as well as representatives from the African Union Commission. And the purpose of this joint webinar with UNESCO was to raise awareness of youth engagement on COVID-19 and to see the contributions of African youth towards combating the impact of the pandemic on the continent. So to find out more about our webinar, you can also visit the UNESCO website through the link below. We'll make these links available in the chat, in which where you can read the whole synopsis of the webinar itself. But I'm going to be looking at just some of the discussion points that were raised during the webinar. So during the webinar, AAB we brought awareness to our digital advocacy on COVID-19 through the use of social media platforms such as Facebook, Twitter, and Instagram to really try and reach out to those that aren't necessarily reading mainstream news, who aren't seeing the communications from government or from the WHO or from other major international agencies. And so we try to highlight the importance of utilizing social media platforms to communicate and engage with youth across the continent. And as one of the UNESCO members mentioned, is to help reach out to the unreached, which we think is a very important point of some of the work we do. And so it helps identify that youth-led innovations to combat COVID-19 across the continent. So we're looking at things such as using examples of the solar-powered automated hand-washing basins being used in Kenya, using 3D printers to print out masks across the continent to meet the shortage, as well as the translation of disaster risk reduction messages, such as from the WHO, into localized languages like Swahili, isiZulu, etc. And so throughout this discussion, there was this realization that youth are an untapped resource in the fight against coronavirus, and that youth can be mobilized as agents of change and resilience to help combat this pandemic. And we can utilize youth networks as a means of distributing accurate and up-to-date information to inform and protect youth and to enhance community resilience. But I think most importantly of all is that us as youth members being part of AAB or being part of Inspire or a multitude of youth groups across the globe, we can be role models and we can lead by example for youth across the globe to promote a culture of safety and risk aversion amongst our communities. So some of the outcomes and looking at the ways forward from this webinar. So AAB has conducted a post-webinar survey to gain insights on the challenges encountered by youth on COVID-19, not just in Africa, but across the globe, and develop potential solutions to overcome these obstacles. We're also utilizing this information to compile a list of best practices and case studies of young African initiatives on COVID-19, which could serve as educational material for future pandemics and risks. So we can build back better and learn better for the future. Through these collaborations, UNESCO has declared to support the African Youth Advisory Board initiatives, including the facilitation and distribution of information through innovative IT solutions, to look at ways of strengthening capacity through integrating disaster risk reduction to create a culture of safety amongst young people, as well as advocate for meaningful youth engagement in disaster risk reduction policies and plans. And this is particularly important in the African continent, in which youth make up over 60% of the entire continent's population. Through these webinars, we also gave us the opportunity to open channels of communication and cooperation with other youth groups, particularly Inspire, so hence our invitation to participate today. And over the last several weeks, AAB and Inspire have been identifying areas of joint activity to link youth in Africa and Asia to promote greater DRR on the continent. So this is my time for today. I didn't have very long to speak because obviously time is of the essence, but if you want to find out more about us, please feel free to contact us. So This information will be made available to you guys. So there's our email. You can follow us on Instagram, on Facebook, and also please join us on Saturdays where we hold these safe Saturday chat sessions in which we discuss new risk-related issues every week. And they're not just focused to the African continent, even though there's an African context applied, but a lot of the lessons, a lot of the discussions that we have are very applicable at a global level. So I just want to say thank you very much for having me, and we really look forward to the rest, hearing what everyone else has got to say for the rest of the seminar. Thank you so much.
Thank you very much, Alberto. Thank you very much for this insightful presentations. I think it's also really inspiring as well as motivating us to have a stronger cooperations between the Africa and Asia in terms of this use in disaster risk reduction. And I'm sure there will be a lot of follow-ups that will come up after this webinar for that activity. If you have any questions for Rahma or for Alberto, again, you can use the question and answers, and Alberto and Rahma will try to respond to your questions through this question and answers box that I mentioned. We are now coming into the presentations of youth engagements in COVID-19. There are a number of good examples, lesson learned that we can do, and numbers of activities that youth in Asia and the Pacific has been working on during this COVID-19. And I would like to invite the co-chair of the You Inspire Alliance, Mr. Sofian Aslam, to moderate this session. Sofian, the time is yours to moderate.
Thank you very much, Pak Ardito. So we're moving on to this sharing session for the webinar. The main aim of this session is to share examples of the activities of the Alliance, and also some of the national chapters, and also from other organizations in the region. So it is meant to share experiences and lessons learned from youth and young professionals in addressing the COVID-19 pandemic. And as mentioned by Professor Shahbaz and Madam Shamila, youth is the future. We need to work together. So we are hoping that this session will also spur further initiatives among youth and young professionals, in the future. So in total, we have 12 presentations on various activities. And so for the speakers, I hope that you will be mindful of your time allocated for speaking, and just to be prepared to share your screens. And again, for the participants, if you have any questions related to any of the presentations, you can ask them in the question and answer section. And then the panelists will proceed to answer your questions once they have done. And if you would like to know more information about any of the projects, also feel free to answer it in the question and answer. And so let's move on to the first presentation. So I'd like to invite Dr. Ranit, who will be presenting on behalf of the You Inspire Alliance. Ranit, you can begin now. We have your mic.
Hello, am I audible now?
Yes, you are.
Sorry for the delay. Yep. So good morning, good afternoon, and good evening to everyone joining us from different time zones. I'll make a quick presentation on COVID-19 monitor that we developed as a part of You Inspire Alliance. I am Ranit Chatterjee from India, and currently I am based out of Japan. And as you can see here on the left-hand corner, there are 3 organizations logos which are represented. So this COVID monitor actually was jointly developed by these 3 organizations. I represent 2. I am part of You Inspire Alliance, as well as I represent RICA, which is a social entrepreneurship startup which I co-founded with Professor Rajiv Shaw. Moving ahead. So in case of the COVID-19 pandemic, in the earlier phase of it, there was a lot of confusion, a lot of lack of information, fake news going around, and the community did not know what to do. And as WHO in the initial phase said, this is actually an pandemic as well as an infodemic. There was a huge lack of information. And with the lack of information, the problem is the risk does not get communicated correctly down to the community. And if the community doesn't understand the risk, how will they make an informed decision? So with this, we try to see that as youth and young professionals, as someone with a research background, with people with technological background, can we come together to solve this issue? And what we try to do is a COVID-19 monitor. It's a very simple thing that we try to do. There were a lot of news circulating from different sources on around, like say the press releases, the newspaper clippings, the government database, and also people knew who are getting affected in their area. What we try to do is bring all of them together on a single platform, make it visually available to people to see that what is happening around them, how many people are at risk around them, and what is happening around the globe. So here you can see that there is a dashboard which shows what is happening around the globe. But here you can see a country level data set which shows in each country how many people are affected. And then if you look at India, Malaysia, Indonesia, it also shows so many dots. So these are the countries which started populating the data. And as I move ahead, I'll share with you how we did it on an open source map. Here, what we try to do is look at two possible dimensions. One is, can we track the patients, how they moved across countries? Because in the initial phase, a lot of transmission was happening because people were going from one country to the other, one affected country to the other. So if you can see here, it says that how the transmission happened between between a patient who moved from Malaysia to Indonesia. And then if you if you go back, go to the screen 2, the figure 2 here, you can see there are a lot of yellow marks. So this shows how the disease spreads from one person to different people. So it's very important in the initial phase to understand how the spread is happening. And if we understand the spread, we actually can stop it. The challenge in doing it was data mining, because we are looking at a huge set of data. There was no compiled data. So we were trying to dig out data from different sources, put it down, clean that data, and make it a set which can be uploaded for everyone. And that data needs to be validated. So we were trying to have 2 or 3 point validation from different sources to see that that data goes right without any fake information into it. The second was page updation, because we are looking at a data set, the numbers are increasing, every country is updating the data based on their own time zone. So how do we keep the whole page updated on a regular basis? And third was the tracing of the patients from the status of open source data, because the patient, once you confirm, after they recover, we cannot trace back how the patients are behaving or where are they going. So it was very difficult to actually look at the status of the patient. But having said that, this actually has a lot of use, because it gives you a very good research database with all this compiled data, which once the COVID pandemic is over, the database will not be there. Or if you want to track this kind of a database and see that how the information, the infections actually spread, this database can be opened up for people to use, and it would actually help in filling up that data gap in science and technology. With that, thank you.
Thank you very much, Ranit, for your presentation. And indeed, as mentioned by him, fighting the misinformation and the infodemic is a very important and very critical thing to do. So in the following 3 presentations, you will see some of the initiatives done by some of the U-inspired chapters in tackling those sort of issues. And so next, I would like to invite Mr. Sergzan who is representing Central Asia, to present his presentation.
Hello, everybody. Can you see the presentation?
Yes, we can.
Yeah, thank you. This is Sam. I'm from Dacryn, Disaster and Climate Resilience Youth Network, or Inspired Central Asia chapter, which is working in 4 countries, 4 Central Asian countries, in Kazakhstan, Kyrgyzstan, Uzbekistan, and Tajikistan, and which is supported by UNESCO Almaty Cluster Office. So I'm going to present, as a COVID response in our network, we are working on 2 main activities, which one of them is aimed on science communication and open science by interviewing the local scientists on their research towards COVID-19 and translate it on a common language and spread among people and make it understandable. And the second one on which I will focus in this presentation is about the COVID-19 Mythbusters campaign, which is aimed at disinformation in internet and social networks by providing reliable science-based information authorized by such organizations like WHO, and by bridging the language gaps in our region, because here in Central Asia, many people doesn't speak Russian and English, and we have to translate it in local languages to make sure that this information, the crucial information, get the end users and the communities, and ensure the access to information from the WHO website and other agencies who are working on COVID-19. So this campaign is aimed at communities living in a remote area or in a rural area, and for 4 countries and in 5 languages. So this is what we did. Actually, this is fact sheets about the 10 facts about the COVID-19, which is translated on 5 languages: Russian, Kazakh, Uzbek, Tajik, and Kyrgyz. Here you can see it only 2 languages. Just put it. And we are going to spread it through the internet, through the social networks, our website, the website of UNESCO, etc., and using the community radios. I just received the answer from our focal point in Community Radios Association in Kyrgyzstan that they received this information and going to share it through the radio to make sure that those people who are living in a remote area and rural area who doesn't speak Russian and English, they got this information via radio. And they also had the lack of internet in those places. So that's what I actually wanted to share with you. And if someone wants to share the experience about how we did it and what was the focus, etc., you're welcome. We can share the experience. Thank you very much. That's it.
Thank you very much, Sam, for your presentation. And indeed, I think Central Asia is a very big region, which probably has not been as involved with Unspire activities at the moment. And I think there's definitely a lot of opportunities there. If anybody, any of the participants is interested, do get in touch with Sam. Sure. And next, I would like to invite Mr. Moit, who will be presenting on negating misinformations. Mr. Moit, the floor is yours.
Thank you, Sufyan. And thank you all the honorable panelists and honorable guests as well. This is Moit Mujib Jilani from Inspire Pakistan. As a matter of fact, that Pakistan, being one of the developing countries of Central Asia, largely relies on its young generation. Even according to a UN report, 212.2 million people is the total population, of which 64% of population is under 30 of age. So it was very necessary for this kind of challenging situation to mobilize this certain age group to make a larger impact for all the activities. So for this certain situation, Inspire Pakistan, as part of its efforts to mobilize youth in DRR and consequently contributing to the coronavirus activities, were more focused on negating misinformation and promoting scientific research, and also spreading awareness related to the novel coronavirus. The following activities were carried out, which can be jotted down in 3 categories, of which this is the first one is social media, in which we had a myth-busting series. The myth-busting series, and the second category is for webinar, and the third category is for the scientific research. For the social media activities, mostly the common myths circulating on different social media platforms were busted with the help of scientific research, and conveyed using different languages, local languages usually spoken in Pakistan, namely Sindhi, Punjabi, Gujarati, and Balochi. This had a great impact. Overall, we had been able to see a large engagement on our social media platforms, and around 18,000 people were able to view this social media campaign. As part of another social media campaign was to launch another COVID-19 resolution, post-COVID-19 video campaign, as part of the good news accompanying the COVID-19 pandemic and the willingness to change within among the COVID-19 witnesses brought us to the idea that we should hear it from them directly. And for this point of view, we have launched a video campaign in which we will be hearing out people for their resolutions of this post-COVID-19. For the second category, we had a perfect example of SETI in DRR. Dr. Riazuddin, from an assistant professor at NAD University, developed a low-cost ventilator. Inspire reached out to him and interviewed him, which will be going live on 16th May 2020 at 10:30 p.m. on Inspire Pakistan page as well. He will be sharing his throughout motivation to develop a low-cost ventilator here in Pakistan, and the challenges and the motivation he had to face. Also, Dr. Shamsoon Fareed, a survivor of COVID-19, was interviewed by Inspire Pakistan to listen his journey, and during that live session, he was able to narrate his surviving story, telling people about the symptoms and mental and physical stress he went through his isolation period. This session was also was a complete success, and it made a 7.2 thousand reach on the Facebook platform. Moving on, scientific research was also carried with the help of youth and young professionals, mobilizing the youth and young professionals, predicting for this one of our Inspire Pakistan member, I would like to acknowledge his work, as his work is in the manuscript phases and is about to be in the reviewing phase of one of the journals. He predicted the peak infection for the coronavirus in Karachi, and according to that, it is on the 150th day. Moreover, a transboundary coronavirus disaster management plan was also prepared to help the local authorities to make the lockdown more effective using the remote sensing and GIS techniques. For this, all activities, I would like to acknowledge the youth and young professionals who have worked with UNSPA Pakistan to help this challenging situation. Thank you. That's all from my side.
Thank you very much, Mohit, for that presentation. And indeed, it shows the power of social media for youth in spreading information. And I recommend to those who are very interested in joining the sessions that Mohit has mentioned, that they can go through the UNSPIRE Pakistan Facebook page. So next, I'd like to invite Mr. Tanmay, who will be presenting on the best practices for youth. Mr. Tanmay, you go.
Am I audible?
Yes, you are.
Yeah, okay, great. So good afternoon, everyone. I am Tanmay from CRRP India. Would like to present our initiatives during the COVID-19 pandemic. As you all aware, we have worked together on COVID-19 monitor, and data forms the core of any online portal, and CRRP India rose up to the task of creating this database. The first 8,355 cases reported in India were tracked and traced. To create this database, our 16 enthusiastic volunteers worked tirelessly for tracking each and every case that were reported. Unfortunately, we failed to trace the cases beyond 8,000, but the huge data set that we have now is a gold mine, and we have planned to make it available for research purpose after due data hygiene. The another initiative is we always believe in science communication, risk communication. Based on this observation, CRRP India started publishing visualizations. Yeah, you can see the as you can see cumulative cases day in day out, and different types of visualization has been spreaded through our social media platforms and our website to bring an awareness, particularly a rate of recovery versus fatality, which gives the better pictures than creating panic among the communities. The another initiative was Voices of Youth. In these trying times, it is absolutely essential that our volunteers, our youth and young professionals get to voice their thoughts, ideas and concerns. So we started these blogs. We encourage our volunteers to pen down their thoughts, feelings, responses have been absolutely thrilling. The blogs are multifaceted, from the concerns of infodemic to a gender sensitive perspective, from analyzing lockdown through the lens of DRR researcher to the heartfelt thoughts of DRM professional. The blogs are true representation of how the youth perceive this pandemic and their eagerness to be a part of the solution. You can always check these blogs from our website. Next initiative was we are exploring ways of spreading awareness. So since blogs were catering one section of the society, so we also released multilingual awareness videos. We have received comments from international organizations, reputed practitioners and experts, which is truly encouraging for our volunteers. These videos were multilingual and can be found on these links. We particularly release it in English, Hindi and Assamese. Soon we will release in few other languages. In addition to this, some researchers, out of their own volition, has started conducting a playful surveys. So these surveys are to gauge psychosocial states of the respondents. Soon we intend to come out with a document on it. Apart from this, there are individual contribution from our volunteers. Our members and volunteers in their individual capacities have been contributing in all ways possible. Our members are involved in various webinars, from business continuity plannings to COVID-19 and disaster management, etc. Few of our members have also been actively involved in relief distribution in different parts of the country. These are the few honorable mentions of our volunteers. Thank you.
Thank you very much, Tanmay, for that presentation. And again, it highlights, the importance of youth in, engaging with the society in fighting the COVID-19 pandemic. So next, I think a lot of you will have the agenda for the webinar. And next, we were supposed to have a presentation from Timor-Leste. However, due to a loss in her family, she had to pull out from the webinar last minute. Her presentation is about sharing is caring, risk communication on COVID-19 in Timor-Leste. So it is a video developed by youth in Timor-Leste to sensitize the community on protecting themselves from the COVID. I think one of my colleagues will be sharing the link of the YouTube video after this in the chat box. And so you can feel free to view the video during your time. And so the next few presentations will be more on risk communication, things that youth and young professionals have done in communicating the risk to the public. And so for that, I would like to invite Ms. Rishi to give a presentation.
Good day, everyone. Can you see my screen, Sufyan?
Yes, I can.
Okay, thank you so much. Hi, my name is Risha. I am representing Inspire Indonesia to share some of our works regarding COVID-19. Actually, we have 4 working groups in Inspire Indonesia, and what I'm going to present now are the works of Science Communication and Knowledge Management Working Group. While the other works, we had also some innovations of products such as low-cost automatic hand washer or the citizen reporting platform, one of which will be presented by another Inspire representative later on. Okay. Sorry. Our engagements in risk and science communications for COVID-19 basically are categorized into 4 type of activities. The other 2 on the left are the infographics, conducting webinars, as well as creating video. Those are aimed at raising awareness through social media. While the ones that I'm going to present today are the 2 on the right, which is conducting social research and creating guidelines for tsunami evacuation during COVID-19. First, in the social research, Inspire Indonesia is part of the social panel team for disasters, which consists of researchers from different institutions, including the National Disaster Management Agency. With the urgency to provide evidence-based policy on COVID-19, we conducted rapid assessment through online questionnaire and phone interviews on 4 different themes, which we think are the major issues which needs to be addressed immediately. Since our main objective is to support policy, so we try to analyze everything quickly and summarize share the summary of the results to the government through the National Task Force for COVID-19, as well as to public through infographics and webinars. What you can see on the right side is the snapshot of a presentation by the Ministry of Transportation to the President of Indonesia regarding one of our study results on mobility to be considered on the policy. And finally, we also involved in developing guide for tsunami evacuation during COVID-19 crisis, realizing that COVID-19 risk is not the only risk in Indonesia, but we are also prone to earthquakes, tsunami, and other hazards, which can happen at any time, even during COVID-19 crisis. This is a collaborative efforts of different national agencies related to disaster and tsunami, facilitated by UNESCO IOC Indian Ocean Tsunami Information Center. And on the slide, you can see the practical guide and the sections. Basically, the contents consist of how to implement tsunami early warning system in Indonesia in the context of this crisis. And finally, also we have the section on how to prepare tsunami evacuation before the tsunami happens, during the evacuation, and at the evacuation shelter itself. Also on how to evacuate people based on classification of COVID-19 affected people. In Indonesia, we have 4 categories of affected people to COVID-19, so we describe based on that. And this guide is presented in 4 pages of leaflet in Indonesian and English, and they are already featured in official government websites, including being one of the Indonesia's COVID-19 protocol, as well as an example or reference to the UNESCO IOC for tsunami evacuation during COVID crisis. In the near future, we are planning to conduct a webinar to disseminate about this guide. So thank you very much. If you have any questions, you can put it in the chat box. Thank you.
Thank you very much, Rishi, for that presentation. And I think, yes, it is very important to remember that during this time of COVID, natural disasters can still happen. And how we react to the natural disasters will be an interesting thing to see. And I think that is where the guidelines are very important. So thank you very much for that presentation. So next, I'd like to invite Ms. Sukrit, who will be presenting on the risk assessment tool for COVID-19. So Ms. Sukrit, the floor is yours.
Hi, thank you. Good afternoon, everyone. I am Sukrit Bajwa. I work with RICA, Resilience Innovation Knowledge Academy, which is a social entrepreneurial startup. Which is a social entrepreneurial startup in India, and I am thankful to CRRP and You Inspire Alliance for this platform and opportunity. This presentation is on COVID-19 risk assessment tool, which is developed by RICA and supported by India-Japan Laboratory, Kyoto University, hosted by Amazon Web Service and Professional Links. So this tool assesses the risk based on a small questionnaire and has 4 important parameters: health, behavior, exposure, and social policy. Within health, we have taken 4 factors. First is old age, because elderly are more at risk, and then comorbidities, gender, as well as whether one is a smoker or a non-smoker. When it comes to behavior, we have taken factors like practicing the use of mask, practicing hand washing, or using sanitization before touching face, practicing social distancing, and the behavior component also includes 2 factors of anxiety, level of stress, and whether there is trust on the current government measures regarding management of the pandemic. With respect to exposure, the factors include the type of residential building, because whether you're in a shared accommodation or at an informal settlement, that tends to increase the risk vis-a-vis in a detached housing. Second factor is the occupation, that is whether you're on the front line being engaged as a health worker or in an emergency essential service provider or as a law and order enforcement personnel. The third factor is the travel history, of course, and also whether you have been in touch with the mass gathering around in the last 14 days or so. With respect to social policy, the factors include the current effectiveness of the lockdown in the society and the community compliance of the behavioral factors of use of mask as well as use of sanitization. So as we see, most of the tools that are available online or in the form of an app mostly assess the risk based on medical symptoms. However, this tool factors in behavior symptoms as well as social policy symptoms. Such features determine the preventive measures being taken at individual as well as the community level. Till the time there is a set cure, the only effective way is prevention through awareness. As we have seen in earlier presentations also, there's a lot of focus on awareness. So this tool reiterates the awareness message by prompting the question on compliance of risk preventive behavior. Hence, this tool goes beyond contact tracing and assessment based on only on medical symptoms and includes behavioral assessment also. This tool is simple to use with minimal data entry. It is easier for people who don't find technology very friendly or older people, for them also to use. It's available in 7 different languages. It can be contextualized to include other specific needs or other different languages as well. The tool includes maps, which are generated through crowdsourced data entry, and the tool helps NGOs, government agencies, or other stakeholders in planning their response. It is cost-effective, helps in faster decision-making, and we are very delighted to share that the tool has featured at international platforms like International Science Council and Global Facility for Disaster Risk Reduction. The tool collects no personal information related to your mobile phone, and hence it very delicately balances the privacy concerns as well. So at the end of the survey, this is how the results are depicted. There are 3 categories of risk: low risk, moderate risk, and high risk. Along with visual depiction of the risk at which it stands for the user based on the data entered, we also tell a general advisory of hand washing and awareness features. And if one falls in the high risk category, there are certain points of action which can be considered for that person, along with having a toll-free number also. So as it was earlier mentioned, the need of using science and technology and innovation for community preparedness. So this tool is an example of creating risk awareness, risk communication, and helping in right decision making. So thank you, and please do take the survey. The link is here, and it will also be shared in the chat room, and also take a step forward towards understanding this. Thank you.
Thank you very much, Sukrit, for that presentation. And indeed, it's very interesting to see how the social behaviors are also taken into context when doing those risk assessments. So that is a very good initiative. And so next, we will move on to the presentation by Dr. Vivian Howe, who will be presenting on behalf of her and Mr. Khairuddin from You Inspire Malaysia.
Okay.
Good evening, everyone. Good morning and good afternoon. So we are from the You Inspire Malaysia, and myself is Vivian. I'm going to present on the leveraging of the local resources and capacity. Basically, it's how we engage together with the youth, and then involve in the community programs, and together with this, how we actually do all the activities in order to help the frontliners in Malaysia. And this is actually part of the activity that me and Mr. Khairuddin, where he prefer people to call him Dino, in for the past 3 months. So have some brief up that seeing March that Malaysia having the one we call movement control order. And this movement control order has been started in March, and then it lasts for the past 2 months until recently government has declared conditional movement order. So what happened is, then me and Mr. Dino have been sitting down together with other youth group, and then we decide to actually helping out the social group. And that comes to us that we have been facing different challenges, and these challenges including the financials, manpower, resources, social, the safety and health of the youth, and also the volunteer that we will get to engage and help, and also the accessibility to all this. And of course, we see that challenge into the opportunity, and that is how we actually plan and work with 4 main activities for the past 3 months. The first thing is we gather the volunteer from the Malaysia Red Crescent Society, and also we find the community volunteer among our community in our connections, and then we advocate them to do the do-it-yourself face shield and apron. And this is important because at that time we realized that at the early stage of the MCO, we having our healthcare personnel is actually telling us that they're having the limited resources of the face shield and also the apron. So that is why we gather all the volunteers together to do this. And the second activity is we provide the emergency and the first aid care. This is where we work together with the local government, local council, and then those certified first aider and the paramedic will given, we gather all the homeless community in one community hall, and then we provide the first aider and the paramedic care, because at that time, we realized that the healthcare personnel have to be focused on the healthcare centers or the hospital and whatnot. So this trained first aider and also the paramedic could play part of the role in closing the gap that helping them to deliver the healthcare services. And because of the first and the second activity, it comes to the third activity where me and Khairuddin, we start up a community ambulance where we call TH ambulance. And this ambulance is where we're having a list of registered community first aider. We need to say if you are the trained first aider or if you are the trained paramedic or the medical assistant, and whenever you are available and you will be on standby. So this kind of the ambulance will go to the low income community, and we given access to do the pre-screening, pre-triage system to screen whether they have any severe acute respiratory infections or influenza-like illnesses. So the main reason that we want to do this because people from the low income community during this time, they are actually having difficulty to access to the healthcare services, or they are a bit afraid of whether that kind of symptom is related to, COVID and whatnot. So this ambulance is actually driving around in the low community areas and helping them to provide them advice, consultation, and the services. And the last thing that we do is we work together with the local government and also the National Youth Council Malaysia, and together with other NGO who is needed. We wanted to empower the youth that even though they are not the professional, they are not the healthcare people, they are not so-called the frontliner, but then we engage them through the National Youth Council Malaysia, and then we're having them to help us in delivery food and then deliver different sort of the services to the low-income community, and then collaborating with the government and also the NGO. So the whole activity that we learned for the past 3 months is that if we alone as a social enterprise or the NGO, it is very limited for us to access to all the community in need when it comes to this time. So it is important that we can leveraging the local resources, empower the youth through a right channels and maximize the capacity. So this is where we can help the frontliners in a better way to move together in one directions. So that is from us, from the Youth Inspire Malaysia. Thank you.
Thank you very much, Vivian, for that presentation. And I really like the point that you bring in that the COVID-19 pandemic is affecting people in different ways. The people in low-income community are affected more, and it's amazing to see what the youth are doing to help and provide assistance for the low-income community. And so that is fantastic. Next, I would like to invite Mr. Said, who will be presenting on crowdsourcing for COVID-19 using open source technology. And so Said, the floor is yours.
Okay, thank you very much, Mr. Sufyan Aslam. Good afternoon, good evening, everyone. I'm Iban from Inspire Indonesia. On this honorable moment, I would like to share about what kind of COVID-19 intervention that we have done so far. And our topic is about crowdsourcing COVID-19 data using open source technologies. So let's get started. As we know, COVID-19 cases have skyrocketed within few months, but these numbers makes us confused. And is this the real numbers? Some journalists state that the COVID-19 model is hard to build. Why is it hard? Obviously, the answer is data. Specifically, if we are talking about getting accurate data in Indonesia, it's like finding a Pokemon. So we decided to use a different method. And our innovation is gathering real-time data with crowdsourcing method. It named Lapor COVID-19 or COVID-19 reporting platform. It's a platform to share COVID-19 info from citizen by the citizen. We aim to collect unreported COVID-19 cases that missing from official statistics. Hopefully, this platform will give new insight to the government so they can understand the situation in real time. And Unspire Indonesia lead from the technical development process of this platform. Anyway, my role is as a data scientist. So what makes us different than the other initiative? First one is crowdsourcing method. By this method, we can get unspoken and undetected information from citizens because they happen to easily share stories and information on the internet. And the second one is collaboration mindset. Actually, it's a combination between collaboration and action. Yeah, we love to collaborate, and we believe that although we are strong by alone, but we believe that we can be unstoppable if we are move together. So we have better understanding to finalize our system from different point of views. And thank you very much for all the collaborators. I will show you. And talking about the technology, our technology is 100% open source, so we can reduce the bill. We have our own GIS server and leveraging common chatting platform in Indonesia, such as WhatsApp and Telegram. At this moment, we still use manual verification, and the analysis is automated on the server side. So here it is, the workflow system of our platform. And the upcoming feature is telemedicine. It's a feature with collaboration from Indonesian Doctor Association. And these are the statistic report from the first month. We got more than 3,000 engagements. And this is our map visualization of each city, district level in Indonesia with 9 categories that we have standardized more clearly. And based on the data we get from volunteers who manually crop from 514 local gov websites. And this is one of the data processing results that we get. This graph reveals the number of suspected death cases of COVID-19, which are far more higher than the official COVID-19 death cases statistic published by the central government. And also we have produced the several data visualization to give recommendation for Indonesia government. And our achievements so far, we have been covered by national news agencies and live on national TV station. So what's next for us? We are scaling up. Chatbot is working. Now we are planning to develop vulnerability maps for COVID-19 within village level, and we'll be using comprehensive calculation based on the latest pandemic vulnerability index references. We will use artificial intelligence to give technology to help us calculate and visualize the data. And exactly, we still need support in this part. So here it is the baseline of our first trial in Jakarta. And this is the collaborator. This has been a fruitful journey with this awesome organization. Ton of thanks with these organizations. It's such an honor for this opportunity, and I'm beyond grateful can share our story with all of you. So thank you very much from Indonesia, and welcome to the new normal.
Thank you very much, Syed, for that presentation. And indeed, I'm amazed that these things can be done via social messaging such as WhatsApp. So I think if other people from other countries are also interested to do something similar in their countries, but you can definitely contact Syed, and he will be able to assist or provide or collaborate with you. So thank you very much. So next, I would like to invite Mr. Suraj from Untitled Nepal, who will be presenting on their initiatives in the country. So Mr. Suraj, the floor is yours.
Thank you so much, Sufyan. Hello, namaste, and good afternoon all the way from Nepal. My name is Suraj Gautam, and I represent Inspire Nepal as a co-lead. And I'm working as a research associate in Institute of Himalayan Risk Reduction. So after every disaster brings both the opportunities and challenges. So we as a youth and young professional, we began to sort and explore the opportunities, what we can do during this COVID-19 response. So I will be talking about this in my presentation. So the first of it, we started a social awareness campaign with the collaborations with Nepal Engineers Association, Bagmati Province, with more than 13,000 engineers. And it is supported by Institute of Himalayan Risk Reduction and Himalayan Risk Research and Risk Institute. So far, we have been providing the information regarding where are the isolation centers, where are the different types of facilities the government is providing against the COVID-19 response. Such kind of informations and IEC materials are being prepared, and these are being shared across the media. So this is what we have been doing as our social awareness campaign. Moving on to the another part, that is the major thing is what we did is we began to work in Nepal. After the March 24, there has been a lockdown, and within a period of like 4 to 5 days, using the collaborative approach and taking support from different organizations and also from the contributors of Inspire Nepal, we developed a COVID-19 information portal. So that was, that was endorsed by the Ministry of Health and Population, and we provided with the facilities of the routing feature that would provide us the nearest location of the testing centers and the available quarantines and isolation centers data. Similarly, we also had the facilities of a self-assessment form where the user staying at the home quarantine could fill up the details, and based on the fill details, they would be provided with the 3 indicators. That is green, indicating that they are safe, whereas the yellow indicates that they might be vulnerable, whereas the red one will be directly followed up by the ministry. So in this way, more than till May 14, more than 36,465 data were received by the people from the home quarantine filled those data. And we have also developed the mobile app, and till date it's like 98,000 downloads, active downloads can be seen. So in this way, we have been communicating with the we are working with the ministry as well as the people to give the correct information and also to explain the real scenario. So apart from that, we as a young and youth professional, utilizing the time period of the lockdown, especially the air traffic flow is comparatively very less, and the air quality and the visibility is quite good in this time. So that's why we thought it as an opportunity, and the cities like Kathmandu, which is very much densely populated, so we coordinated with the local authorities and took the permissions, and we flew the drones. So generally the data from the Google Earth, like we had the available data of 30-meter resolution, but by the help of this drone, we can generate the resolution up to the 10 centimeter. So that means that would be a very good help in the disaster planning works and also in the urban planning work. So in this way, Inspire Nepal, different volunteers from Inspire Nepal has been coordinating with the organizations like Naksha, Nepal Flying Labs, and any Nepal Engineers Association and different organizations, and working towards bringing something positive. So apart from that, we, the volunteers of Inspire Nepal, have also been working on some initiatives like the development of swab collection booth. So what normal PPEs, like normal PPEs, what a health worker can do is they can just stay inside the booth and they could just examine the patient and collect the swab. So that would really help to prevent the contaminations and to prevent the flow of aerosols. So in this way, we have coordinating with Nepal Engineers Association, Bagmati Pradesh. Till that, 16 kayaks have already been developed and deployed. Similarly, to promote the health workers and the staff nurses, we have also worked closely with the robotics community and has thus developed this sister robot. So this robot is capable of carrying the medicines and is also capable of carrying food materials, which will be to the patients in the isolation center. So that also reduces the chances of transmission. So in this way, this has been a new revolution, and currently the Bagmati province of Nepal has inaugurated this system and has been actively used in the Bagmati province capital, that is in Hetauda. So in this way, we have been working on the number of initiatives. What we think is the necessity is the mother of invention. That's why in this time, especially the age groups that we are, that is young and youth professionals, we can definitely contribute a lot in our different ways. So I would like to the main lesson learned during this response period is the collaborations and the development of platform. That I think this is what Unspire Alliance has been aiming for. It will definitely help to showcase the ideas and also co-create ideas with the multiple stakeholders, and that will definitely also promote for the multidisciplinary studies and thus work for the sustainable risk reduction. And thank you so much. This is what I have for today.
Thank you very much, Mr. Suraj. And certainly, I agree with the quote that you gave towards the end, in that necessity is the mother of invention and innovation. And certainly during this COVID-19 pandemic, the necessity is there for youth and young professionals to innovate and invent and to help their community and the society. So I think that is a very comment to make. So thank you very much. So next, I would like to invite Ms. Fatma from Unspire Maldives, who will be presenting on her project looking at the tourism industry. So another industry which is affected by the COVID-19 pandemic. So Ms. Fatima, the floor is yours.
Good morning. So I'm Fatima from Maldives, and I'm Unspire chapter lead for the Maldives. And you could see that Maldives is a very are
you sharing your screen, or will you be sharing your screen?
I'll be sharing.
Sure. Thank you.
So I'm Shadia, Fatima Shadia from the Maldives, and I'm the Unspire chapter lead for the Maldives. Maldives became Unspire chapter very recently, so we are at a very infant stage of the chapter. And looking at other chapters, we are very inspired to do our best, and we are learning a lot from other chapters. Even in this webinar, we have seen a lot of things that can be applied for us. But even though we are in this infant stage, we are still interested to do some of the activities. So the first activity we decided is to assess our situation. So we have found that COVID is impacting our country a lot. The first COVID case was confirmed on March 7th. Maldives is a tourism destination, so it was an imported case from abroad. We have a lot of tourists coming from Germany, Italy, and China. So our first confirmed case on 7th was an imported case, and this continues, and we were getting more number of cases of imported COVID patients. And therefore, on 27th March 2020, our borders were closed to tourists to prevent a community spread. But however, what we found is a month later, in the early April, we found our first case in the capital city, Male. And after that, rapidly, a lot of people started to get infected by COVID, and now we have a community spread. You can see now on 15th May, we have 933 cases, and then four people are dead, and then 45 recovered cases. But the recovery is very slow for us. When we're looking at the impacts, we found that the most impacted sector is the tourism sector. Our GDP heavily depends on the tourism, and you can see about 30% of the GDP is contributed by the tourism sector, and many people are in this sector. But when the resorts are closed due to border close, many employees were sent on no pay leave, and some of them have already lost their job. So employees who lost their jobs are very concerned with losing their job, and we found that they're not ready to move to another sector. And some of them are using the time of the quarantine to upskill their knowledge, they're thinking this is a good time to do that. And many private businesses related to tourism are closed. And then there is this concern, how long can COVID-19 last in the Maldives, and when are we going to open the borders? And since if there's no inflow of tourism in the country, what are the sectors we can look in? And we found that agriculture and fisheries are the next best alternatives. When we look at our youth engagement, we are also very much interested in finding out how our youth are volunteering, and then what can youth do in this situation. So our first concentrated effort is to do some research on youth volunteerism in the National Emergency Operations Center and other places where the volunteer work is occurring. And we found that there is a hesitancy in the youth to take part in volunteer work. And then there's a shortage of youth volunteers in the Maldives. Looking at the factors why this is happening, we found that our social setting, the household setting, is an important factor, because many people are living with their extended families, and we have our elderly living with us. And elderly is one community or one set of people who are very vulnerable to COVID-19. So even though youth are interested to volunteer, they are still not able to do the activities because the fear of spreading the COVID-19 at household level. And also we have found that there is real fear of people, especially youth, contracting the COVID-19. So fear and the social setting are one of the biggest challenges we found in youth volunteerism. And then we are now assessing how UNSPA can contribute to education and also the skills that is needed for fisheries and agriculture if our youth, those who lost the jobs in tourism sector, if they wanted to move into this sector, they will need some kind of training. Therefore, we are finding out how UNSPA Maldives can contribute through education to these sectors. Currently, our areas of concentration is research, how we can conduct research in the Maldives regarding COVID-19, what are the vulnerable sectors, and what are the challenges youth faced in volunteering. And also, we want to know how we can contribute to tourism sector through research. And also, we are interested in creating youth awareness on volunteerism. And we are very much interested in learning good practices from other countries. Therefore, we're thinking of making booklets on good practices of other countries and sharing it online to youth who wanted to take part in volunteer activities. But by taking good practices, maybe the fear can be reduced, and they will know how to contribute even from remotely to the needed areas. And also we are interested in preparing educational materials to educate public on new norm. We are moving to a new norm in our country, and we know that social distancing will become part of our everyday life. And for tourism destination, how will this impact our society? And then even in schools and other areas, how are we going to have this social distancing, hand washing, and what are the impact on our society? So we think this is a very good area for us to create educational materials and aware the public so that there is harmony in the society. And we are actually talking about how to go about in these things. And we are brainstorming and trying to find ways we can contribute in the future. So that's what we are doing at the moment. Thank you.
Thank you very much, Fatma, for that presentation. And I think it's very important because the COVID-19 pandemic has indeed affected tourism in a lot of countries, and a lot of youth, especially when it comes to related to unemployment. So these are the questions, and some of the questions that you are asking, which are very important, and it'd be very interesting to see what you find in Maldives, and perhaps it could be similar to what other people find in other countries as well. So this is something that can be developed further, definitely. And so again, we have received a lot of questions from participants in the question and answer sessions. Our panelists will do their best in answering a lot of them. And so still remind anyone that if they still have any questions, feel free to answer it in the question and answer section. and not in the chat box. And we will do our best to answer a lot of the questions. And so we have come to our last presentation for today, which is from Miss Wuhana. And she is speaking from, and I hope I don't get the pronunciation wrong, Te Manawaro o Ngati Hine. And she is the CEO of Ngati Hine Forestry Trust, and she is leading and planning for the indigenous Maori COVID-19 response. So Ms. Wuhana, the floor is yours. It's very interesting to hear what you are doing with your community over there.
Kia ora everybody, and thank you for the opportunity to present tonight. I'll just start sharing my screen. So on behalf of Te Manawaroa o Ngāti Hine, I give greetings to all that have joined us. Ngāti Hine, our kaupapa or our objective is to empower our families through their homes, through their sub-tribes and communities for the provision of crisis support in this COVID-19 space according to their own protocols on their own terms. So just to provide you, like our other speakers, a bit of an overview in terms of New Zealand versus Northland, where I'm based, and what we do within Ngāti Hine. In New Zealand, we've had really strong national leadership. So our national leadership came in and they said we're going for an elimination approach and we're going in hard. And so we went into lockdown maybe 4 to 6 weeks ago and we locked down in level 4. And saw a quiet across our country in the elimination approach. They sought to flatten the curve and maintain the way with which we kept ourselves safe within our communities and our homes, and then sought to instigate ongoing testing, closing the borders, and moving forward really strongly at a national level. So as you can see within our statistics, we have only 1,400 odd, nearly 1,500 confirmed and probable cases, and only 21 deaths within New Zealand. Now taking that down to our region in Northland, which is in the northern part of New Zealand, we've only had 28 cases since COVID-19 came into our shores, and we've had no deaths. Now the good thing about us in Northland is that we've had in the last 3 weeks no further cases within our communities. So from New Zealand to a regional approach, we've had really strong leadership, and I'm going to share with you some of our gains and our wins in terms of both national, regional, and then local, in terms of what we in Ngāti Hine have achieved through collaboration and working with our neighbours, entrenched and underpinned by our relationships through our genealogy or whakapapa. So the Te Manawaroa approach is both at strategic leadership level. We're taking a regional approach, we've got good planning, we've got good strong cultural leadership, our communications is across multiple platforms. Our approaches are informed by intelligence, and data is key. We've heard that throughout the speakers, whereby knowing your community better, then you can fit the response according to the various needs of those within your community, within your homes, and within your families. Having really good logistics, having the right staff at the right time available to suit the activities and the response that's required, and then quality service delivery on the front line. People going in with a view or a spirit of giving, a desire to protect the health and well-being of the community and those that they work with, but also to support our loved ones and our elders in particular, who are some of our most vulnerable in our communities. So in a Māori approach, and we are the Indigenous people of New Zealand, we throughout New Zealand and then within Northland have taken a really strong leadership approach for our people, by our people, for the entire community. I just want to talk about the Māori approach to the response in COVID-19. And from a national level, we have a whānau ora approach, which is family wellbeing. And one example of strong leadership nationally into Northland as well, but nationally we've had hygiene packs supporting families to stay safely during the lockdown period. safely within their homes in terms of, as we've heard, sanitation, keeping their homes clean, keeping their families safe. And these hygiene packs that have gone out, 120,000 hygiene packs to date across the country. And we've had a ton of them come into Northland, and within Ngāti Hine, we've been coordinating with our neighbours as neighbouring tribes, neighbouring communities, to ensure that every family has access to these types of resources. So the Ngāti Hine approach to our COVID-19 response has been collective impact, where families are empowered to provide leadership in this time of crisis, and by empowering them to make decisions according to their own protocols and their own desires, and gain the objectives that they seek to achieve in protecting their own health and well-being. So within Ngāti Hine, we have a health protection approach, and we also have a well-being approach. So it's a tribal-led response for the entire community, bringing together both community groups, business, local government, religious leaders, families, young people across our various levels to provide a united long-term response to COVID-19. So the areas of work that we have been targeting within Ngāti Hine as a part of our Northland approach from an iwi or a large tribal grouping is welfare, health and well-being, social support, and economic recovery. So in the crisis response, we've spent a lot of time in terms of health protection and the welfare space, social support. Our comms has been both reaching out, 0800 numbers to call in, calling out to our families who are within our boundaries, talking, setting up phone trees, staff ringing their clients, becoming more knowledgeable about what's happening within homes, as we're in the lockdown period, and what are the urgent needs, but also what are the trends, so that intel or the intelligence, the gathering of intelligence provides a strength by which we can then plan our responses both immediately, but also in the long term. Partnerships have been really, really big within the collective impact approach by looking at who is within our region, who can help us, but also what are they doing within these spaces. We don't have the answers for all, but if there is leadership locally in different communities, and Māori communities and mainstream communities, let's partner together in order to achieve goals and gains that are according to their own protocols or their own practices on their terms. So one of the areas that I wanted to speak about is the well-being, hauora well-being. And in Te Manawarua o Ngāti Hine, we've had a lot of effort in rural communities. So as Northland, we are primarily a rural community with small pockets of families that can be miles away from the main road. And we are based around a communal space called a marae, our gathering places. And so the health teams, our nurses and doctors, have been out in the community taking COVID testing into the local rural communities, and also flu vaccinations, immunisations. So it's a broad approach. As you can see from the poster, it's available both to our elders and our young people and our families to come forward and be tested, but also for them to also present with whatever is happening within their homes. If they do need vaccinations and immunisations for their children, come. If you have sniffles and you think you've just got an average cold, come. So by having both the community testing stations, as you can see, there's a photo there of our team. That's a community testing station. You drive in, they test you from your car, and then you drive back out. Then you have the outreach team that goes into the local communities, and they do the same thing from the car, and the nurses and the doctors are there to support. So that's an example of the way with which the teams have been proactive, both in inviting families to present themselves, but also through the 0800 number. And we also have Google Forms, Google Tools, which have been sent out to our communities to invite them to share what's happening in their spaces, what does their bubble or their household look like, and what are their emerging or current needs. Further, something else that I want to speak about is kete koha. Kete being a basket, a koha being a donation. So this has been a really big area of delivery in terms of the crisis response. supporting families to stay in their homes during the lockdown period. Now, the lockdown was really effective for New Zealand. It kept us in our homes, and we were trying to encourage through the welfare approach of these kete koha to help our families stay at home, to make sure that our elders were at home and that we could deliver food parcels to help them to supplement their shopping. And where possible, understand more of what's happening within their homes. So you can see there, we've had both Meals on Wheels approach, where we've had hot food prepared for elders, along with other staples. Then we have family packs of shopping that have been taken out by volunteers and staff into our communities, both urban and rural, on a weekly basis. In the mid-north of our area of Ngāti Hine, we have on average 200 packs of welfare, these kete koha, going out into the community. And most of them are rural, so that they're driving quite large distances to get food into the community to encourage our families to stay at home and look after their health and well-being. And then by taking the nurses and the doctors into the community, again, please stay at home, family. Please keep yourself safe and well. In the urban space, just as of this week, acknowledging our team, today 200 hot meals were delivered to our elderly community in the city of Northland, the one city that we have in Northland, Whangarei. We've had a big outreach into our community, and so acknowledging those who were cooking the food, our teams that we're helping with the distribution, and also, once again, knowledge is key. By understanding what your community looks like, what their current needs are and their emerging issues, you can then tailor the support. Tomorrow, the team, again, in collaboration with our tribal partners, this is Māori-led collaboration of iwi, large tribal groups, coming together alongside our corporate sponsors and government funders, and to enable us tomorrow to give 200 further welfare packs into the Whangarei city, the city of Whangarei. Today also in the mid-north, a further 200 packs were distributed by our team. So what I want to share with you is the fact that an Indigenous approach, Indigenous Māori leadership, both at a national, a regional, across Northland, and then within Ngāti Hine, have been stepping up to provide the strong messages of safety, of reiterating what we've heard from our government in terms of keeping ourselves well, but also inviting our families to communicate and tell us what are their needs, to encourage our families to get tested. If they are fearful, the testing stations are available in your community. We have strong collaboration across our tribal groups in Northland, who also coordinate with our local district health board. So that's our regional health authority, and also our local primary healthcare providers, working across multiple levels. One thing that I do want to share around young professionals and young leaders is that they sit across multiple levels of this action. So we have young professionals sitting at a strategic level, tribally, within the health sector, district health board, within the local operational space, again, young professionals. And then because we're trying to encourage our families to stay at home and our elders to stay at home, young people again stepping up in this welfare space and in the service delivery space, being front facing. We have good health, so it's incumbent upon us in terms of the way that we want to nurture and care for our families and our communities, that as young people we are stepping out and we are doing the work on behalf of our community. So just wanting to reflect to you the way with which we have a strong elimination approach at a national level across New Zealand. The government's been really strong in that and seeking to flatten the curve, and you've seen that in our statistics, that we've been really successful in that space. So from that national leadership, Māori as Indigenous people of Aotearoa New Zealand then stepped up nationally and said, yes, let's do this, coordinating national Māori responses, and then in the regions dropping down to us, the tribes of Northland, alongside our district health boards, alongside our government partners and our business community, come together and continue to work together to provide regional approaches that are specific to us in Northland. Ngāti Hine dropped down again into our region, whereby we collaborate with our tribal partners, our community groups that are just amazing, great community groups, excellent leadership, and the corporate sponsors who want to help as well. So it's trying to bring together the various partners for collective impact. So that's the underpinning methodology for Te Manawa Roa o Ngāti Hine, is looking to work with our neighbours, looking to work with our partners, and particularly from a Māori approach is the importance of genealogy and our family connections that bind us. So putting politics aside, putting concerns aside on other matters and focusing on quality service delivery to our people. Again, intel or the sharing of that data and information actually informs where we're going into the future, because we know a lot more about our community now than we ever have before.
Ms. Huhana, unfortunately, I have to stop you here because I think we're running quite a bit on time. But thank you very much for your presentation. I think the gist or the most important thing from the presentation is the importance of community and society. And I think during this pandemic, definitely it has brought us closer to our communities, to our families, and to our societies. And it's nice to see how the community functions during this pandemic. So I think thank you very much for your presentation. For the interest of time, we will move into the next session. Participants can still submit your question and answers, and the panelists will answer them in the question and answer part. If not, you can send us an email with your questions, and we will get back to you, as soon as possible. And so I would like to wrap up the session for today by saying that these are amazing initiatives being done by everybody in the region, by youth and young professionals. And it's very interesting to see how these initiatives can be shared and done with in different regions. So that is for me for this session. I will give it back to Pa Ardito, who will move on with the following session. Thank you very much to all presenters.
Yes, thank you very much, Sufyan. Thank you very much for all the presenters. As Sufyan mentioned, this is all these are very interesting presentations. I'm sorry that due to the time constraints that we have, we will move to the next sessions. And for this, I would like to invite Professor Shahbaz as the Director and Representative of the UNESCO Regional Science Bureau for Asia Pacific to moderate the sessions, which will discuss about the challenges and opportunities, the output and closing. So, Pak Shahbaz, I would like to invite you to chair this session.
Thank you very much, Pak Ardito. So this is the session where we have to bring everything together. So we have heard 12 excellent presentations, right from Central Asia all the way to New Zealand and many interesting countries in between, and many interesting things which our youth and young professionals are doing, from monitoring, from providing technical solutions, inventing new ways of ventilators, to community engagement, local indigenous knowledge. So there is a lot of ground which has been covered. So I'm very pleased that this is really excellent work which the network is doing. Now moving on, I will be assisted, of course, with Pardito, and there is a number of colleagues who are there, like Khairul, Fajr, Rahma. They are collecting questions from the chat. And because of the time constraints, we would like to limit this whole last session to around 15 minutes. So I request these colleagues to make sure that none of the questions or the comments are ignored. So we will be preparing a summary from all this work. Also, a book is being prepared. There are nice introductions prepared to all the presenters. So you will be finding that very soon. But now let's try to bring what are the opportunities? What are the key challenges which we are facing? How do we work together? And how do we actually solve these big challenges which are interconnected with COVID, but also very much at the core of our existence on the planet, and how sciences, engineering, technology, innovation brings it together. So for that, first, let me ask 4 colleagues from the network and from our offices to just give 1-minute impressions. What are the key things which come to your mind as we have heard these excellent 12 presentations? So can I ask first from Daniel from U-Inspire Malaysia, what are the key things which comes to your mind from these presentations? Is Daniel around?
Yes, Prof, I am here.
Yeah. So quick impressions. What do you think of what has been said so far?
I mean, thank you everyone for the excellent presentation. I learned a lot. So I think we've done so much. I'm also doing quite a number of projects on this COVID during the pandemic. As one of the lead contributors for the World Economic Forum COVID Action Platform, one of the biggest challenges that we actually facing is the digital divide within the community. And this divide actually includes in the absence of devices and also digital literacy. And since we've been talking a lot about social media and communications and everything, so I would actually, get a little bit of idea from everyone in U-Inspire. How do we actually address these gaps to include everyone in the community within our actions? Yeah.
Okay, that's really an excellent example of quick impression. There are digital divides. How do we overcome them? How do we connect together? Let's park this question. And really very good impression from Daniel now. Can I ask Arina Rafliana, who has been part of this network right from the beginning. What do you get from today's presentations, Arina?
Hello, Professor Shahbaz and everyone. I'm so overwhelmed with excitement. My smile is from ear to ear, responding or learning from the proliferation of initiatives throughout the globe. This is indeed a global movement. I think it's very important for everyone to understand that they are really making a truly significant impact, not only for the COVID situation, but really on redefining this complex risk, which is redefined significantly against the tradition of our disaster risk reduction system. And I think having youth in the forefront really contribute this significantly. And I would later on ask or appeal to the UN bodies, to the national government, to international organizations to allow a more wider space for youth and young professionals to more proliferate this effort, as offered kindly by Madam Shamila on how to do interregional collaboration in this sense. But what strikes me actually is how, for example, the guideline on tsunami response or tsunami evacuation is now adopted by the North European and Mediterranean tsunami warning system context. So that's a really true cross-boundary kind of contribution that is contributed significantly by youth and making differences as well. And I think this is just one example of how you all are really making a true impact. And what really strikes me as well is how, I really love Iban's remark, welcome to the new normal. I think this shows really vividly how youth and young professionals are the most ready layer of generation to adapt to disruptive changes. And I think the other generations should learn from this and should be prepared more. And I think this sentence, welcome to the new normal, also resonated by Maldives. How do we educate the new normal to the public? This is actually what needs to be done in the next step. And I think we are more happy also to see how, for example, in New Zealand, there are no generation divide seen in all of these proliferated movement and success achieved. Every youth and young professionals are infused in all of the different layers, from policymaker to the community to local leaders. And we don't talk about your youth and you are the older generation, this is what we do, this is what you cannot do. No, that is not the thing. The intergenerational issue is also what we need to address. And I think the youth and young generation needs to always appreciate whatever resources around. And again, I would only congratulate and then be immensely proud. And I thank also Pak Ardhito Kodijat for the initiative on this, and also for engaging me as well. Would like to say quickly hello to Animesh, and also Pak Professor Chunli, Rajib Sensei, Pak Andi Eka Sakya, Madam Shamila, also to other colleagues that I cannot say hi, but I'm very happy that I'm part of this discussion. Thank you.
Thank you very much, Arina. Thank you for your idea. Is Raza Shah around also? Can he give a very quick 1 minute impression? Raza? I saw maybe he has a problem with his mic. So can I ask then our colleague Fang Lian from China, you are online today? Okay, looks like maybe there is a small problem. But really these two comments were very, very valuable, good impressions. Before we move to impressions from colleagues with more experience and have been working into the DRR area, we have, with the help of UInspire, the panelists prepared some statements on how do we move forward. Ardhito, can you please display those statements and share the screen of the PPT with all the colleagues? Okay, so very quickly, yeah, can we put it on to the full screen?
Yeah.
Okay, all right, that's good. So this is basically trying to summarize from all the presentations and the intentions, how people are working together. So as you have heard from our ADG and from all the colleagues from UNESCO, we really recognize and appreciate the work which is being done by youth and young professionals. The investment we made in 2018 has certainly paved the way for reaching where we are today. So the first statement really is the appreciation, and science, engineering, innovation, all those areas are very relevant to COVID-19. So this particular network is really doing a great job, and youth and young professionals and their activities are very, very important for all stakeholders, very evident from all the presentations, and we need to make them more widely accessible. The questions which have been asked, they're asking also, can I be part of some of the solutions? How do I link together? So these two statements really capture the spirit of UNESCO's effort to bring youth and young professionals together, and especially in the context of open data, open science, innovation, solutions. Next, please, Pradip. Okay. So we will continue to advocate and facilitate youth and young professionals with platforms such as UInspire, and we have also our colleagues from Africa, IAB. And there are many colleagues in the chat box who have expressed interest to join them and ask how can we extend them. So these networks are very important, and especially for science, engineering, technology, and innovation. And the area of disaster risk reduction, the issue of water security, the Sendai framework for disaster risk reduction, and we shouldn't forget about the sustainable development goals. So we will continue to promote youth and young professionals for all these areas, and working especially with the UNDRR, and we will hear from our colleagues from UNDRR as well. UNESCO encourages youth and young professionals, and I want to draw your attention. There are many UNESCO youth programs, and our ADG Science is a very big promoter of youth, young professionals. Within UNESCO, we have a UNESCO Youth Forum, which is a very important forum. We have special youth networks for climate action. We also, in our office in Jakarta, have many initiatives for climate change champions. So, and also there are wider United Nations youth programs. And within our efforts in disaster risk reduction area, you will hear from our colleague Animesh. There are many things which are happening there. Next, please. So now the statements on U-Inspire Alliance. Alliance is basically bringing together from national level to the regional level. This is a challenge I pose to my U-Inspire colleagues, that we should make this as a key body. So it looks like we are reaching there. The national chapters will continue to advocate, encourage, mobilize their members to continue and actively work and engage in COVID-19 activities at all levels, finding solutions together and good practices. We will actively work with the U-Inspire to document, bring together a platform, and encourage those solutions to be continued all the way through the community level. Then U-Inspire would continue to advocate meaningful engagement of youth and young professionals in the implementation of disaster risk reduction, water security, climate change policies and plans through science, engineering, technology, and innovation. And the cooperation will be further developed through the national chapters as well as through the regional youth organizations around the world. Next one, please. Okay, so those are the statements. Hopefully they have captured the spirit of this webinar. And how can we move forward from here? And we will hear from our ADG as well. This is our suggested way forward, that there are many good practices already. We have clearly seen, I saw Shamila's comment in the chat, that excellent, many, many good solutions. We want to support you. Certainly, that's the spirit of UNESCO. So case studies of youth and young professional initiatives, we need to bring them together on a platform. And more than 170 colleagues through the survey have shown many good practices. We could only fit 12 of them into this very interesting webinar today. We will be documenting all of those good practices and their engagement, and this will be made available through the links which we will advertise. Also, there would be a special book which is being produced, which will be shared, and also the ability for people to connect together. UNESCO, U-Inspire Alliance, and IAB-DRR. So we will work together with all of you. UNESCO is open to everyone to join through our science networks. So please don't be shy. Link with our field offices, with our regional office, and our senior colleagues in the headquarters. Next, please. Okay, so there are these links where we will be providing these statements. These statements are what we have thought together so far. They can be further enriched. There are many questions, and many colleagues have answered some of those questions. We will enrich them with those. You're most welcome to share your ideas, inputs, comments, and suggestions. And there are a number of email addresses we share. We will be sharing all these presentations with you, both from UNESCO and from the U-Inspire Alliance. We will be working together, and this becomes an ongoing action. I also want to let you know that UNESCO Science Family, UNESCO sites, the MAB network, the IHP network, the science policy related networks, the open science initiative we are going to bring together our senior scientists together on the 19th of May with the government of Japan and government of Malaysia. With the ideas which will come together from here, we will put them for seed funding from those particular initiatives. So there is an initiative which can help you to move forward to the next level. So that was our brief statement and the way forward from here. So I thank everyone for making effort to contribute to these statements. Now, I would like to request our two very important colleagues who have been working with us with U-Inspire, with UNESCO in the region. So first, if I can ask Dr. Animesh Kumar from UNDRR to give his impressions about what has been discussed today and how can we really be part of solutions and hope for present and for future. Animesh.
Thanks, Professor Shahbaz. It's always very inspiring to be with you, Inspired. as has been the case from the very beginning. And good to see you and good to see all the colleagues. I'll try to be as brief as possible. And as was pointed out in the beginning by Dr. Shamila as well, that this disaster, the crisis we are seeing now is just a reminder to all of us that how important the Sendai framework is, which for the first time brought the biological hazards and disaster risk reduction together. So if you look at the health crises in the last 20 years, never the disaster risk reduction community has worked so closely with the health professionals to tackle a health crisis. And in most of the countries in Asia Pacific as well, the disaster management machinery is actually running and coordinating the response and recovery from the pandemic. One important point that I would like to raise here for consideration of all the colleagues is the 4 years back in Thailand, the Bangkok Principles were adopted, which are the principles, 7 principles to bring together health and Sendai framework for disaster risk reduction together. Now, these are 7 very strong principles with some very actionable components. And they have not got a lot of traction, but now we are hearing and receiving requests from the governments that they want to operationalize it, considering they hadn't thought of it, that this would happen, but now it has happened. So Bangkok Principles is something which gives us a very strong, valid basis to take it forward. Now, you, Professor Shahbaz, also in the beginning pointed that considering we don't have a vaccination, considering we don't have a known treatment yet, the only option, which is a very pessimistic way to move, but the only option we have is to live with the virus for the time being, which essentially points to the fact that we need to define the new normal. And as against other disasters where we do have an end date, and then we move towards a recovery stage, so will not be the case with COVID. So the end date is not in sight, but we have to move towards a recovery. And how this recovery stage will define the new normal is the answer we have to explore together. So I have 3 key suggestions, which are the opportunities that we can explore together, and Unspire can become a very strong conduit to do so. One is, which has come out very strongly among all the presentations today, is technology. And a technology which is not only low cost, not only can operate in low capacity environments, but also is carbon neutral and also is climate sensitive. So that is something which is very important. We have already reached a stage where the CO2 emissions in 2020 is 8% less than in 2019. Let's try to maintain this level. This opportunity will not come back. So low cost climate sensitive technology is the first. Second is innovation. So Unspire is like, that's the reason the ether for Unspire, they are innovative. But how do we share this innovation? Is something which is very important. Otherwise, time is not on our side, and we cannot keep starting from the scratch. So how the sharing of innovation can happen? So platform like the one we had today was good. We need to have more such platforms where we can share the innovation. Just to give an example, the presentation made by Sukrit on the COVID-19 risk assessment tool, we saw it. It's very simple, very good tool. And we are now replicating it and moving it to use the same tool for business resilience and risk estimation that Ranit is helping us with. So we can replicate what innovations are already existing, but then they need to be shared. And the third thing is that often we tend to focus on generating knowledge, but the knowledge needs to get translated into behavioral change, needs to get translated into attitudinal change. And this is what the need of the hour is. The gap between knowledge and behavior can be filled only when we have the right communication, the right risk communication. So I think the Unspire and the colleagues therein have a very strong role to play, as we have also seen today, in helping that the communication channels, medium, including social media, can be strengthened so that we can fill up this gap. So I would stop there, but I think looking forward to hear more and continue collaborating. Thank you.
Thank you very much, Dr. Animesh, and very excellent ideas you have shared from UNDRR on technology, on innovation sharing, on bridging the gap from knowledge to behaviors. And that's where the local indigenous knowledge also plays an important role. So we will continue to work together with the network and with you. Now I invite another very special colleague and a very close friend, Professor Rajib Shah from Keio University, who is a mentor to many of the colleagues. So dear Rajib, what did you get from today? What are your wisdom thoughts on how we go forward from here.
Thank you. Thank you very much, Shahbaz. This is already 2.5 hours, possibly the longest webinar I have participated in last couple of months. But I think it's worth spending this time because the diversity of all the experience is so high. The initiatives are so deep. So I really learned a lot, and a big congratulations to the U-Inspire Alliance team, UNESCO, and all who supported it. So thank you very much. I think the way I see the initiatives, of course, it's just only 5 minutes or 10 minutes presentation. I know that you have done lots of deep work there. The way I see possibly in 3 categories. One is this technological innovation. We saw some very interesting product. We also saw some interesting tools. Some possibly worked, some possibly did not work. But the most important thing is that you made an attempt. And for this type of very uncertain disasters, which we are seeing for the first time, I think making an attempt, making your individual attempt, making collective attempt is very, very important. And we make lots of failure also. So it's very, very important to possibly analyze what worked and what did not work. And that brings a good lessons. So I go back to your place. I think that if we can not just document the good practices, but also the lessons which did not work, I think that will be a very, very big lesson for our future. So that's number one. I saw also lots of data science applications, and I think there are many researchers, young researchers, who are working on this data science. And means we have been talking about the role of data science in the disaster risk reduction for many years, but possibly COVID really showed us that how this big data can play a very, very important role in the scenario planning and different types of phasing out and so on. So I think that part possibly needs a little bit more strengthening, and I will be very much interested to learn more from your experience, what you are doing in future. And of course, your main work also on the advocacy, risk communication. I think that's a very, very strong work which you are doing also for other types of disasters, and you will possibly continuing in doing that. The important part here is now we are going from response in many cases to the recovery. And of course, your job has not yet finished. We have a big hope also for your contribution to the recovery phase. And this recovery is so context specific. What happens in one country is totally different in other country. So I think this context specific documentation analysis of recovery, whether it is the fiscal recovery, whether it is psychosocial, whether it is livelihood, different types of recovery. I think that will be a very, very important area where I would like to really see some good work in the U-Inspire Alliance. My last comment was last week, I was contacted by one Canadian journal. They asked me to give what they call a time capsule message. They told that give in 250 words what you want to say to the people in 2050. So I can't say, because it is time capsule, so I can't say what I wrote there in 250 words. But very important thing to do that, I actually went back to 30 years back, 1990, when we started this whole international decade of disaster risk reduction. And this 30 years has really changed us quite significantly. So the youth now, what you will be seeing possibly 30 years later, will be again totally different. So please think about that. What is your main lesson from this particular disaster, which you would like to actually bring forward to the future generation? I think that's also very, very important. So we have a big hope on you. And thank you once again, and big congratulations for the very, very good work. Thank you very much.
Excellent, Rajiv. And we need to be in the time capsule to see an end of this crisis and the other more hopeful side, but we have to continue to work on all these big challenges. And thank you for all those good ideas for our documentation and data science and advocacy. Now I would like to invite our ADG Science, Dr. Shamila, to give her impressions and ideas under her leadership. Dear Shamila.
Thank you very much, Shahbaz, and thank you to all of you. It has been extremely inspiring and motivating to hear you speak, to hear of the different initiatives that you already have across the world. And I think what I would like to say is the last speaker mentioned, you are our hope, UNESCO. And I have to turn this back to you. The youth are our hope. The youth can bring transformative change. The youth can bring about the changes we need in attitudes, behavior, society. The youth can bring technologies to development. The youth develop new technologies. The youth have access to a multitude of ideas and innovative engineering scientific methods that are necessary today. So we need to build our future in a co-creation, co-design with youth. You hold the key to our future. The future is yours, and you need to design that future for yourself. We are talking here about the role of science, technology, and engineering for the future of mankind and to put us on the good track of sustainable consumption and production, as well as economic growth and environmental sustainability coupled together. And science and technology and innovation is rooted in there. But how do we build the next generation of scientists when we cannot have access to science and technology in schools? We need STEM education. You as the youth can start the movement for STEM education across the world, that science becomes a reality, that children continue the critical thinking, that children live and see science and the value of science for development. Only you can start the movement, because you are experiencing right now the value of science and technology for development. But you need to pass your values on to the millions of children across the world who are unable even to go to school today. We need to build the next generation of scientists. We need the children to want our science, to love the science, to want to follow the science, to be interested by the science, but to have the access to the science education. We have at UNESCO what is called UNESCO Microscience Kits. We have produced UNESCO Mini Robotics. How can we, through you, Inspire, develop this across the world and start the movement that every child understands the meaning of chemistry, physics, and biology? I grew up in the mountains of South Africa. My mother used to work in people's homes as a maid. One day she came home with a microscope. It was to be thrown away. And she gave this to me. And as a young child, I put leaves underneath it to see what could I see in a magnified view. And that's how I started my interest in science and in biology, was simply through having access to a microscope, which I did not know was called microscope at that time. Imagine how many millions of children across the world are waiting to be given this opportunity. You Inspire, you can do it. The future is yours. I call upon all of you, and my plea to you is to start, together with the Jakarta office, together with UNESCO, the movement for science education, so that every child across the world becomes science literate, to be able to participate in the dialogue, to be able to shape the world, and to be able to understand the world around us. I thank you very much. Looking forward to working with you, and let's work together so that science is at the hand of every child across the world, that let's build the future laureates, Nobel laureates, the future scientists, the future data makers, the people who are responsible right now for coding, the people who are responsible for water science, water management, environmental science, computer science. Let's build that generation of scientists for the future with you. So we look forward to working with you, and you are our hope. Thank you very much for giving me this opportunity. Good luck to all of you. Thank you so much, Shahbaz, for organizing this amazing panels. It's been wonderful listening to all of you. And my last plea, if I may, can we identify 3 activities among you that you will replicate across the world in what I'm calling interregional fertilization and interregional collaboration? Let's share experiences across the region. Science knows no boundaries, and the planet, there's only one planet, and there's no planet B. So let's work together to ensure a good, sustainable planet for all well-being. But let's ensure we have the expertise and the scientific expertise to manage that planet for us and for future generations. Thank you very much. Stay safe, be safe, and look after you.
Thank you very much, dear Shamila, for excellent closing remarks and giving so many ideas. I especially like this challenge of 3 inter-regional activities. And we find the funding for that also. And here we have Africa as well as Asia together, and there are also colleagues from US. So hopefully this should start also from European Union. So we have enough material now to work on some of your ideas and the ideas which have been given by Dr. Animesh and Rajiv and all the Unspire network. So this brings us to the end of it. I thank Pa Ardito and the team in UNESCO office Jakarta for this excellent work, Gani for great designs, Yama for keeping everything going, Sachi and other colleagues for all their background work, and from the Unspire, every one of the speakers, the chair, Pradip, Rahma's excellent overview, Sufyan's excellent coordination for, and every speaker keeping to the time. So because there's so many ideas, we have to continue to work together. We will continue to provide feedback. All the questions which have been answered, the answers may not be final. Most welcome to connect with any one of us, and we will continue to provide the answers to those. And we will, as I said, on the 19th of May, we are bringing the whole region and all science networks together. Unspire and the work from here would flow in there, and we will bring it to the attention of our donors, especially Japan and Malaysia, to have that South-South cooperation and activities between regions. With that, we thank all of you for staying so long, including on the live Facebook. Is there anything remaining, Ardito, or we can close that now?
No, we can close. Maybe we give clap to everybody. Thank you very much.
Thank you. Have a wonderful day, and thank you for staying for so long with all of us. We are so excited. We will solve this problem, and we will.
And don't forget.
Wear your mask.
Don't forget your mask.
We have to wear the mask.
Yeah.
Okay.
Thank you very much.
Thank you.
Thank you, Animesh. Thank you, Rajiv.
Thank you.
Thank you, Professor Rajiv. Thank you, Animesh. Thanks a lot.
Thank you, everyone. Thank you.
Thank you, Professor Rajiv. Thank you, Irina.
Thank you, everyone. Congratulations.
Yes. Thank you all speakers.
So much, and
have a good weekend.
Thank you everyone.
Thank you, Sukrit.
Cheers.
Yes.
So if I may suggest the panelists stay on for a few more. After all the attendees left, maybe we can just take a few minutes to.
Pardip, should I stay or should I leave Pardip?
Live on Facebook?
I think we can stop Facebook at the moment.
Yeah.
Yeah, we can stop Facebook at the moment, please. Yama, if you can help.
Okay.
Irina, you are welcome to stay.
Okay. For some reason, I cannot turn on the camera and I cannot change my name.
Ah, yes.
Maybe Payama can help on this.
No, it's okay.
Okay, now it's...
I
okay.
promoted you to panelist.
Dr. Animesh, thank you so much.
That was a... I don't think I've sat down that long for a long time.
Yes, but Sufyan, very good. very good moderating.
Hey,
as always.
Sofian. Thank
Yeah,
you.
give a clap to Sofian. Thank you.
And also Pardip, of course.
Mantap, Sofian.
Pardito.
Yeah, both were excellent moderators.
Let's take a group
Sofian
photo.
idola.
Let's take a group photo with all video turned on.
Sofian idola.
Sufyan, you need to do an Indian dance to a Bollywood song.
Indian. Why do I have to do Indian dance?
So
you will have no problem with your neck.
Chair Pradip, turn on your video. Okay, let's take a nice photo, all of us together.
Alberto, I can see you now.
Alberto, I can see you now. Dr. Anim.
First of all, I would like to congratulate. I would like to say thank you very much. I think the webinar has been very successful. All the presentations are amazing. We have, although we have almost 376 people registered, I think participants, we reached only until about 180. But still, it is a very good and it shows that we have a very good interest from all the youth. And of course, there are maybe some people who miss the timing or miss information. But it's a very good attendance. I think we have a very good received, very good comments and input from Professor Pradip, well as from Animesh, and also from Madam Shamila. This is something that we need to, I think, do some follow-up after this workshop. I suggest you take the weekend off first, and then we'll resume again on Monday. Because we have been working very hard, almost 2 weeks in preparing this webinar. So let's take a few days off, and we'll start again on Monday in trying to do what exactly follow up that we can do. There are some ideas also from Madam Shamila in terms of thinking about 3 interregional cooperations. So this is something that we need to follow up. And I think the strongest, of course, interregional cooperations is between UInspire and IAP in Africa. So, and I think as Rahma and Alberto also mentioned, this past 2 weeks, there has been a lot of intense discussion between IAP and UInspire. So this is something that we need to think about and how actually we can move forward based on this webinar. Yeah, so that's from me. I just would like to say really thank you, very hard gratitude for all the hard work. We have been, only us knows from the background where we have this WhatsApp communications, even late at night, early in the morning after sahur, everybody responded to this WhatsApp. So it has been a very good, it's been a pleasure working with all of you. Yeah, so that's basically, this is not the end. This is not the closing. This will be the next chapter in which that we need to work again in the future, in the next near future.
Ucapan raya satu, Pak.
Yes. Go ahead, Khairul.
Ucapan raya.
Selamat Hari Raya.
Ucapan raya.
Selamat Hari Raya still, I think it's still 10 days, right?
Belum habis puasa lagi, Khairul.
He's already our fasting days is still 10 days ahead. Or 9 days ahead.
Okay, I thought you asked us to Raya awal. Okay.
Pardito, I think that Fang Lian is still here and she's raising her hand.
Oh yes, Fang Lian. Maybe we can move Fang Lian to our. Let me. I'm not the. I think
Sudah, Pak. Done.
Oh, done. Fang, Fang Liang.
I think she's joining.
We are sorry. We tried to engage with you during the challenges and opportunities, but it seems also with Raza, as also Raza there. So there are two reasons, I think, the connecting as well as the timing. So we didn't wait too long until you can get connected. Raza, your turn back with Raza and Fang, but I thank you very much for your willingness to join, as well as willingness to actually convey the statement. I really urge you to still send us your statement by email so we can include in the report of this webinar. We're sorry that we couldn't have you live at that time, but we would like to keep your statement on this challenges and opportunities. Okay, Rama, you want to say something, or is Pradip still here?
Yes, a handsome photo guy at the bottom. He's still there.
He's giving proxy.
Okay, so if there is just another, Pak Yama is still here. Pak Yama, the recording is already saved.
Yeah, the recording is still recording actually. We will stop after this, and also I capture the question and answer and the chatting in the chat room. Yeah.
Okay, great, because that would be our asset. So I think the recording, the chat, as well as
Q&A.
Yeah, I think that's would be our asset in terms of when we are going to prepare the report as well as moving forward. So thank you, Pak Yama.
Welcome.
Pak Ardhito, I noticed that maybe Prof. Han Kunli is still here. Maybe we can hear something from Professor Han Kunli if he's still here.
Is Pak Chunli is still there?
Yes, he's here, Pak.
Yeah, maybe if you could also move Pak Chunli to the panelist, Pak Yama.
Yeah, sure. Okay.
Hello, could you hear me?
Hi, Fang. Yes, we can hear you now.
Finally.
Yes, Fang Lian.
Hi, Fang.
Hello.
Hi.
Hello.
Fang.
Yes, I tried to.
Hi. Hi, everyone. Well, congratulations for very successful the discussion. I think it's impressive to see how active U-Inspire is and how many the new ideas and work has been done. I think UNESCO, especially Pradip, and also my colleague Yama, that have made a great facilitation for this. Really wonderful. I think there was maybe a technical problem, and the Fang before have an intervention to make when Shahbaz called, but somehow it didn't work. Maybe Fang, you want to take the opportunity to put forward a few remarks briefly?
Yeah, probably. And so I would like to.
No, we don't hear you.
Okay, and how about now?
Yes, we can hear you.
Okay, so firstly, I would like to thank you for providing this opportunity to for young professionals to share our activities for this pandemic. And I think now this COVID-19 event is shown as a typical cascading disaster and it requires every country to rethink about their DRR strategy in the context of the cascading risks. So we would like to call for strong cooperation, strong international cooperation in sharing information, experience, knowledge, and technical solutions. And also we can see that young professionals are the play key roles in this response for COVID-19. And especially from IRDR's observation in China, we could see that a great number of young professionals have contributed their activities, their knowledges through NGO by providing volunteer activity. They provide online health support, public awareness, awareness communications, information management, and provide some international experience translations. And their products serve for domestic and international multi-sectors who fight for the pandemic, including governments, local communities, media, hospitals, and UN agencies. So I think that it's important for international organizations, international programs like us, IRDR, we should provide more resources to support young professionals. So I think IRDR would like to continue to support the young professional engaged in this pandemic and also other DRR activities by our IRDR Young Scientist Program and our relationship with our partners, and to provide professional guidance and some broadcasting channels to help increase the visibility of young professionals and to help them to make their voice be heard in DRR policies and DRR governance. And yeah, that's all I would like to share.
Great, thank you very much, Fang. I think maybe if you can also send us in writing what you have just made the statement, and we'll make sure that the statement will be also recorded in our meeting report. Just wondering, is there any special call from IRDR for this young scientists, especially for this COVID, or? Is there any special program from IRDR for the young scientists related to COVID-19?
No, we don't really have specific programs for COVID-19, but we work with some local NGOs and to provide maps and some information for government for their decision making. Yeah, there are some local NGOs engaged by a lot of young professionals, including doctors and some DRR researchers and some, yes. We work with some local, IPO work with some local NGOs.
Ardito-san, if I may
yes,
have a question.
Yes,
yeah,
please.
Because Professor Kunli is also here and Fang Lian is also here. Because there are some of us who are part of IRDR Young Scientists. And I guess there are a lot of young scientists spread across different continents. So it might be actually also a good idea to bring all the young scientists together and see what they are doing for COVID-19. Because that also is somewhere connecting to what we were having now, like this young professional thing. So this young scientists also are part of it. And I guess all of us are contributing through research, or there might be a possibility to contribute through research as a team in future. So, and this is not a health emergency. This is a disaster as well. It's a health disaster. So I guess as a IRDR young scientist, we can contribute a lot, and we should come together for this in future.
Yeah, sure.
Yeah. Okay, is there anything who would like to say something? I don't want to, I know Dr. Rajib, Professor Rajib says that 2.5 hours webinar is the longest. And I've been one which is more longer than 3 hours. But I don't want longer. If there is no more
We need to hear from Raza, Pak Dito.
Is Raza still here? I didn't
Yeah,
see him.
he's still here.
Pak Raza.
Hi everyone.
Hi Raza.
Very
Oh,
impressive.
hello, my brother.
Very impressive. Very impressive. And hats off to the moderators and the panelists. Very good discussion. Very productive discussion. Very well managed. I've shared my statement in Q&A, so
Great.
you can copy it from there. So good to see you all, and let's have another session after a few months and see what are the updates.
Next week.
No, in few weeks. 2 months.
Yes, in few weeks. So if there is anything else, if there is, I just would like again, I'm just to say thank you very much. It's been a successful webinar. I know a lot of hard work all of you have been putting into these preparations. You all deserve a nice weekend. So let's not talk about this during the weekend, but I will get in touch with you again early next week, just to start so that we don't leave, it doesn't goes on to a different piling in your desk, so we can still continue to move forward as there are some suggestions that we can actually take some action on. So if there is, then I would like to, shall we resume this meeting? Shall we end this meeting and then have a good evening, have a good week, have a good iftar, break fasting if you are fasting. I'm not going to say Selamat Hari Raya because we are going to meet Hairul. But again, thank you very much. Bye, Chun-Li. Thank you very much.
Thank you.
Bye,
Bye, Chun-Li.
Bye, everyone.
Thank you.
Bye-bye.
Thanks, Rahma, Pradip.
Bye-bye.
Yeah, Bang Rio is there. Thank you, Bang
Hey,
Rio.
Rio. And Sufyan, thank you very much.
No problem. Thank you, everyone.
Congratulations again, everyone. So proud of you.
Elin, thank you also.
See you
Elin.
again.
Bang Rio, balik lagi dong, foto lagi.
Mantap, yo.
Okay.
Rio.
Rio should be inside of the frame. I can see Rio inside of the
already.
Pradip, you need to turn on your video.
Diana.
Sufyan.
Thank you very much. Shall we on the same screen as well?
Oh, Risha is still here. Thank you, Risha.
Bye. Bye semuanya ya.
Oh, and you are together.
Congratulations everyone, especially Pak Ardito, Rama, Ellen, and Ariana.
Yes.
And Sufyan as well. I hope your neck doesn't hurt that much.
I'm gonna lie down now.
Oh, surely you need to.
He's an old man.
Yeah, I'm an old man now. Age factor.
Oh, this is very touching.
We miss each other. We don't.
We cannot turn off. Miss each other.
I think Carol said that once this is over, we're going to Jakarta, right, Carol?
I need a Raya post from everyone.
Sufyan already want to go to Jakarta, Pak Ardito.
Yes.
Yeah.
Not only Sufyan, with me.
Yes.
Both of us.
And
We
I
will
think
have a tour to Jakarta and also to Bandung. So make sure everyone is ready.
Yes, and
Bandung.
Malaysia.
okay.
Bandung,
And
of
to
course.
Nepal.
But we must quarantine you for 14 days.
14
Okay.
days.
140 days?
Yes. Until next year. Okay, thank you everybody.
Okay.
Thank you Rio
I will
and
end this
Sweb for the
meeting.
Facebook and Fajar also.
Everybody is waiting to left
Arigato.
the last.
Leave. Okay, bye. As usual, I will leave.
Bye-bye then.
I want to share my screen.
After everybody
but
leave.
everyone is leaving.
Welcome to the new normal.
Thank you.
Okay.
Thank you, Zaid.
I will close this in 3,
Okay.
Yes, Pak Yama,
Yes,
close.
thank you.
1.
I think you're you're in control, Pak Yama.
Yeah, I will have to cut.
Otherwise, it will
Okay,
not
in
stop.
3,
Yeah.
2, 1.